Okay, we'll open up the subcommittee. So just for committee information as we go forward here, we have 13 bills we're executing tomorrow. And we will be, if anybody wants, I will be sending out my cheat sheet. I'm looking for some sponsors for motions. And so we'll have that conversation. In terms of what going forward, Tuesday is town meeting day, so we will not be meeting on town meeting day. So that means that Wednesday, the 14th, that the remaining 26 bills in the committee, that some of them we've actually acted on, but some vast majority we will have subcommittees on everything on that day. So do not, be warned, that's a good day to be here. Okay, and then the following week, the Tuesday, the 18th, I would be scheduling any more subcommittees or bills from that first day that still needed to continue to be processed, and then we'll exec on the 19th. The 12th. Okay. Yeah, I know. So what day is town meeting day? Okay. All right. So I was off by a day. Okay. Sorry. All right. So in terms of next week, the 11th, which is town meeting day, we will not meet at all. The 12th, I will be scheduling subcommittees for all remaining bills that have not had their subcommittees and everything. So there's, and to my account, there's 23 of them, 26 of them or something like that. Okay. And then 13th is a session day. And then the following week, the 18th, Tuesday, the 18th, I will be scheduling whatever doesn't get done when on the 12th, whatever is left over that needs an extra subcommittee or not. And then, so Wednesday, the 19th, we'll exec the remaining House bills. Okay. And I'll review this again tomorrow when we have our exec session, but I just want, because you guys are here, I get to know firsthand. Okay? All right, first bill up, House Bill 774. Is there anybody who likes this bill? All right, I just try to make sure that. Okay. Speak now, forevermore hold your peace. Okay. I'm sure that the motives were very well intended to try to address this issue. I have to say is for myself personally, who now just officially now joined the infamous health insurance company because Harvard pulled out. I got to always be sure I. And that's why he's hiding in the back of the room. So I found it very enlightening in terms of the issues that are out there with the two different kind of Medicare products. And so in that sense, I'm glad the sponsor put it in. So I've learned a lot and feel much more informed. But at the end of the day, I did not see a solution. So, Representative Spear, would you like to also, we can start with taking a motion and we can have discussion?
Yes, I spent a week studying this,
Okay.
and having been on Medicare for 13 years, I felt it was time for me to go back and look and see what's going on, so I made some charts.
Okay.
And I know you can't
Okay,
see them.
Representative Spear, second by Representative Petusek moves.
I will be glad to give anybody a copy.
Good.
Yes, I would be glad to
That would be
email my
wonderful.
charts.
Cool. Okay. So
One
make
of the
some-
things that did not come out in this, in the meeting is that there are no more Medicare standard plans that cover Part B deductibles. It used to be a Plan F, that was
That's
discontinued.
right. Yeah, F, yeah.
It used to be a Plan C, but that became Medicare Advantage.
Yes.
Right now, according to CMS, there are no plans that cover the deductibles. There are a couple of plans, K and L, that cover Plan A deductibles, but at the rate of 50% or 75% with out-of-pocket maximums of $7,200 or $3,600, depending on what you have. There is one advantage that I can see to Medicare Standard that Medicare Advantage doesn't have. And that is Medicare Standard covers the entire United States. There's only one network. Medicare Advantage is network area specific. And not managed care.
Well, it
I'm
is.
not talking
Managing
about
that
that.
everything, it has to be a network.
It can be
and they have a-
PPO or it can
Right.
be PPO, which is not, you don't need a referral.
Right.
Or it can be HMO, which means you do need a referral.
Right.
And you can specify the size of your network to include down into Massachusetts, or you can actually specify it to be your local area, your town, Nashua.
Right.
The depth can also be specified, how many doctors in that area. And the percentages for the doctors can run 30% for a local area, low depth, or a broad depth area that includes Massachusetts, at 70% of the doctors in that area. So you can select plans all across that. But the advantage that Medicare Advantage has that Medicare Regular doesn't have is whatever these supplemental plans are, in Medicare Advantage, there's no supplementals per se. You are free to switch from any version of the plan you want every single year, and your pre-existing conditions are covered. According to Kaiser Family Foundation, only 2% of people switch between plans. Most people are satisfied, they switch back and forth. They say to use Medicare now, the only recommendation I see for Medicare Standard is if you are living in two states. For instance, let's say you go to Florida for 6 months a year and then New York for
Right,
6
yeah.
months a year, you might want to go with standard Medicare because you're covered in both carriers. Whereas if you live in one place, essentially, then you would get Medicare Advantage. 95%, according to KFF, 95% of Medicare Advantage clients are very satisfied with their coverage. They're finding no problem. You can start out at 65 and thinking that you're healthy and believing you're not going to get into an accident and go with a very minimal plan that costs hardly anything. Or you can have develop a condition where you need to have some real careful care, and then you're going to have to pay more money for the plan and get a broader, deeper plan. And you get to have to pick your insurance company, whichever one you feel good about, and there's a whole potload of those. And so you have a lot of choice, and maybe the best thing somebody has to do is to consult somebody who understands all these things. And I will be glad to email out my little charts, and you can pick your own insurance. So my recommendation is we should just kind of stop the bill because it doesn't do what people think it's going to do. You can't switch back to Medicare and think you're going to get deductibles paid. They don't pay them anymore.
So Representative Spears, second by Representative Petusek, moves inexpedient to legislate on House Bill 185. Is there any discussion on the motion? Seeing none, all those in favor, please raise your hand. 1, 2. Oh, okay. So we just here. 1, 2, 3, 4, 5, 6. Okay. All right. So Petusek, Sally,
Oh, what was the rate? What was the vote on that?
6-0. Okay. Spear.
I had a lot more I could say. I think I feel almost qualified, almost. This one's going to be hard.
This is which one?
241.
He wants to regain it. Okay.
It's fine.
Next up, House Bill 241, relative treatment of alternatives to opioids. I sent out an amendment and ran it up the flag, but the sponsor is begging us to retain this bill. Yes. Yes.
Have we seen your amendment?
I don't know. That is true. You might not have gotten it. It was, I mailed it out. I mean, obviously it was drawn up by Alex at the department. And so all the carriers got it, and then, and he got it, and I guess you didn't get it. So, but I was waiting for his okay. So it was basically I would say the rub right now in terms of the way, the issue is how do we and make sure patients are well informed in terms of making the choices about what they do. And the problem is the way we wrote the amendment was, well, that means we're going to have the insurance companies, send out a letter to the patients and say, what are all the different alternatives that are available to them, that it sort of reeks that we're practicing medicine. So that creates a problem. And we don't want to get into that situation.
Yeah, I just wanted to say for the record that we don't have information about the efficacy of some of these treatments,
Right.
And I was apparently massage works for some things and not for others, et cetera, et cetera. So I'm not comfortable giving a blanket.
Well, it was narrowed. We definitely narrowed it down
yeah.
to the ones that were already, the big one is chiropractic is already statutory, but
Yep.
in the statute. But I think that, I think what's really important that we most need, and I'm not saying this for the camera, that is for people is the nature of healthcare has had in all my years of been doing this job, is that that managed care was always about how what we do to get you healthy, and mental health really kind of brought out that, well, that's a problem because that some people are never, with mental health issues, you have that for the rest of your life. And so now we get into maintenance. And well, managed care that's not one of its favorite things to be doing, is maintenance, is that it's more built around, how do we get you cured? And I think that this bill brings out the same issues we have in mental health, which is, I was acutely aware of this back as I was in the room when we took up chiropractic, and the way the chiropractic statute, originally was that insurance companies were treating it mostly, I would say, like mental health, that the utilization review, that they how many times they'll give you X amount of visits, but then after that they're cutting you off. And the chiropractor, and back then there was two kinds of chiropractor lobbyists. And there was one who was the straights, and the other one was the mix. And I won't tell you the names of the people, but it was a very interesting, because there was two different, coming in, and the issue was how to make sure that that people wanted chiropractic forever. They want to get the twist forever, and so the end result was. Is that we did pass the bill that says if the insurance company covers chiropractic, that yes, you can get 12 visits a year, and with deductibles and or whatever, copays and whatever. And that's been on the statute. And it feels like 20 years. It feels how long it's been out there. So that is already on the books. It's out there, and so it really is sort of a baseline. But sure enough, Cigna. And I can use that name because they're not in the small group market anyways, but they actually, it was called Health Health Source. I forget what was the name of Health Source at the time, and they actually dropped chiropractic when we passed that mandate. But eventually they did eventually turn around and cover it. But that just goes to show that when we do a mandate, there is an implication to to the companies who whether they want to abide by it or not.
Mr. Chair, could you define twists?
The twist, yes. Well, that's what I call it. And I would say years ago, I haven't been to a chiropractor in a very long time. But yeah, a really long time. And I do remember when I was picking up my father-in-law and picked him up but when I would go to the chiropractor and they do that where they lay over and do that twist and I would say over my life at back then, three times, and every time they just one twist was all I needed, and I was good to go. And they would always say, "Don't you want to come back again?" And I go, "I'll let you know whether I need it or not," and they never did. So, okay. So I'll make the motion to retain House Bill 241. Second, Representative Petusek. Okay. Any discussion on the motion to retain? Seeing none, all those in favor raise their hand. 1, 2, 3, 4, 5, 6. Okay. All right, next. House Bill 648, relative to insurance coverage for glucose monitoring. You want to take this one?
We've gone over a lot of the reasons why we should be doing this, and I feel very strongly that this kind of monitoring is very important, and it's going to stop problems in the future. The problem I have, and it's something I've balanced everything with, is it going to risk taking people off the insurance rolls? And it turns out, I did an analysis, and at least as long as I've been here, which isn't all that long, the bills that we have mandated without funding have amounted to about, at most, $2 a year. This one, based on analysis provided by Jason, is going to amount to $22 a year. And that's $22 a year per family member. And that is risky. My recommendation is we retain the bill, see if we can narrow it down a little bit and get the cost down a little more.
Right.
And so my recommendation is to retain it.
Yeah, in terms of negotiating this bill and trying to get an understanding of what is going on now with the insurance companies who are in the state, and it really gets down to the question of how often you test yourself on a daily basis. That if you are just sticking your A1C is not high enough, you're just sticking yourself once a day to see how you're doing. That obviously does not necessarily mean that you really need it. Whereas this machine is clearly necessary if someone's A1C is bouncing around and on a daily basis, then yes, the protocol is that you should absolutely have one of these monitors. And as far as we're understanding is that all the insurance companies in the state will cover you if you have multiple, you need to test yourself multiple times a day. So that's right. I'm just like, so that's the reason why we're retaining that. So we're going to find out whether that's really true or not, and really get into the groundwork and finding out what the situation is. So, yeah, good idea. But just be, you're not testifying, you're just sharing. You're chatting.
Just chatting as Rep. Hope Damon, retired diabetes educator and dietitian. So in response to your remarks, Chair Hunt, I don't have the same understanding on a couple points. So one, not all insurance companies will pay for continuous glucose monitoring for patients whose diabetes is not treated with insulin. And we now have in the landscape of diabetes care a considerable number of non-insulin pharmaceutical options for type 2 diabetes. And it is wonderful that we have those options, in part because while insulin will effectively control blood sugar, folks need to learn how to use it and how to dose and so forth. It will work to lower blood sugar for sure. However, it is also associated with weight gain, and weight gain is a primary variable in increasing risk of complications of diabetes, such as heart disease. The newer non-insulin medications are generally not associated with weight gain. So they're desirable for a number of reasons, but I'd highlight that one in particular, that we are decreasing healthcare cost when people with type 2 diabetes use medications like one category is SGLT2, alphabet soup. When we decrease the risk of complications, we not only help that person have good control of diabetes and go on about their productive life, we help them not have the complications that cost so much money. So that variable of insurance companies covering CGM for non-insulin treated patients, I think, is a very important consideration. The other piece I'd note in response to your good introductory remarks is, yes, CGM is more important for people who already were finger stick testing multiple times a day, whether to determine the dose of their insulin or to better understand their diabetes, or because they have a great deal of fluctuation in their blood sugars, and so they're trying to stay safe, like being safe to drive. You should not be driving when your blood sugar is plummeting. However, many people don't test anywhere near as frequently as would be desirable to do, for a whole host of reasons. One could simply be that, it's not particularly comfortable to stick your finger. It's not horrible. You get used to it to a degree, but it's not pleasant. There are people who have needle phobia who just cannot muster the ability to do that frequently. They're just in a very, very distressed state over the procedure of doing that. There are people who have Parkinson's disease or other causes of tremors, and they literally physically can't really do it effectively, so they need somebody to help them. Or people who are in their workplace setting, they don't have a situation where they can just run off and check their blood sugar, and they can't do it at their workstation where they're working. If you have a CGM, all you have to do is grab your phone and just read it, or it alerts on your phone automatically depending on the device. So I guess I'd like to ask, if it's okay for me to ask the committee, are there folks here who are not yet convinced of the need for CGM in any person with diabetes who is willing to use it to treat their diabetes?
Well, you just threw a curveball.
I did.
Yes, because you were talking about insulin. Okay, so nobody in this room is going to argue that someone who has to take insulin on a daily basis, that there needs to be proper monitoring of taking that insulin. What you just said is, oh no, forget about those people now. Let's talk about the people who are taking a medication for their A1C and have not don't need insulin.
So
That brings a
first of
whole
all,
different
though, forget
dynamic.
about the people with insulin. I would never in a million years say that. But that isn't at issue in this bill because, as you noted correctly, the people who take insulin already have access to CGM. Whether they're type 1 or type 2, I do not believe that that is a problem. But only 30% of people, 30, 35, Liz, of people with type 2 diabetes are treated with insulin. Some of those people are not treated with insulin because they won't do an injectable medication, similar reasons to the issues with finger sticks. Many of them are not treated with insulin because we have better ways to treat it. The meds that I referred to, some of which are oral and some of which are injectable. So that's, I'm sorry if
you're
that
still
sounded like a
testing
curveball
yourself.
because I thought we had talked
No,
about
but
that.
you're testing yourself multiple times a day.
You should
even
be.
even if you're on a pill. Did you
Yes.
only a pill that you only take that pill once a day? You
So that depends on the individual patient and it depends on where their diabetes management is at. And it's not a static response, even for the individual patient. So, for example, we might say to a patient newly on a non insulin medication, we might recommend that they check their blood sugar several times a day for the first 2 weeks to see how
Whether
are
it's
they
working right,
responding to
how
that?
well,
How's
right.
it working? Do we
Yes.
need to make adjustments? Do they
Right.
need to time their eating differently or their exercise? What all the variables are.
right.
And then if their results are good and consistent, they might not need to test as frequently, and that person might be well informed by a CGM, but I don't know that I'd say it was necessary.
That I want you to understand. That's exactly why we're retaining this bill. We're trying to figure out that threshold. We are obligated, obviously, in terms of figuring out what we're going to mandate to the insurance companies and what they have to do, is that we have to say, draw this line. Where is the appropriate level? And obviously, we might not agree on this issue, okay? But and as I can't refer to this, Representative Spears says these machines are not cheap, okay? And that these and you're gonna get a new one or whatever. Yeah, Representative Spears, you want to follow up?
I wanted to make a comment on that. None of us are doctors. None of us can say what the real scope of how diabetes should be managed.
Right.
And I looked at it every way I can with Hope's help, every way I can. And on the surface, not being a doctor, I think we got to do something. But one thing I do know is numbers. And $22 a year per family member is going to knock people off the insurance rolls. And that I do understand and can talk to. And so while I can't talk to the medical part of it, I can talk to that
Right.
part of it.
Right.
But
Representative Gross.
can I ask, somebody from either the insurance department, do you agree with that assessment that it would be $22 a person per year?
So before he speaks, the $22 was based on the unamended bill when it included the exemption from deductible and copay. So with the amendment, with the devices being subject to deductible, the $22 is no
That's
longer
why
valid.
we have to retain it, because we don't have those numbers.
We need to have that study done. Yeah.
Yeah.
Do you want to hear from the
Yield-
insurance
yield-
company?
yield,
Yeah.
yes.
I mean, not company, insurance.
I wasn't prepared to talk on this.
No,
just
I understand,
briefly,
but-
Jason Azis, Director of Health Economics from the Insurance Department. We did write a fiscal note on this bill. I just wanted to point out two key things. That the technique that we use is we try to identify the marginal cost of this mandate if it were enacted. So how much does each unit cost with all of the other things? Noteworthy are the clinical requirements that are also associated with, which are 18 months. I would suggest those are organized in the plan year, not 18 months, just for conciseness and cost reporting. But then we multiply that times the new eligible population. That's the spurious part, because the technique we use is how many people become eligible that weren't previously eligible if this bill were to become law. And I just wanted to point out that insulin therapy status is the current eligibility criteria, not frequency of blood.
Insulin's correct. Right.
So we look at what proportion of the population who have diabetes have type 2 diabetes, and of them, what proportion, as Representative Damon stated, are currently on any type of insulin therapy, and it's approximately 30 to 32%. As a side note, it is noteworthy that Medicare has reduced the criteria for that eligibility basis based on 3 multiple daily injections down to 2 as of April 2024. So you do see this indeed this migration away from the intensity of insulin therapy as a criteria. Taken together, that value, I think, that Representative Spear is talking about is the upper limit of the absolute cost, if taken all things together, if this bill were enacted. Knowing that it'll never be 100% of the new eligible population that would take this up, but some unforeseen proportion of that, which is why we put indeterminable, because we don't know that. It's having worn one for years, it's quite invasive, and it adds to the work burden of managing the chronic disease of diabetes. So we know that it's not going to be 100%. So it's hard to predict what will be the absolute fiscal impact if this bill would become law. But I have a couple of suggestions. I think that we could make this bill more narrow if we better define the eligible population. I heard
Well,
Representative.
that's exactly what we're saying. We're
So-
talking about that.
So
yes.
bifurcating the different types of diabetes therapies in the type 2 population, those who take medications, those who don't, and maybe what types of medication.
And that's what we hope. Okay, so just so everybody understand what retaining means we will come back to this in September and we work on it in September, and we will have
Put it
to
together.
vote on it. It has to come out of committee by the end of October, and it'll be on the House floor in January.
But if you want to work on it over the summer and we can nail down an amendment really good in the usual way that I have, I'd be glad to help work with that.
Happy to help. I work at the behest of Commissioner Betancourt, so at his directive, we're happy to
Right.
help elucidate.
And he seems to listen to us, so we will make sure that.
Thank you so much.
So, yeah,
I just
That's
want to
great.
ask Representative Spear, where did you, how did you get the $22 a person?
that was in the fiscal note.
Okay.
Well, no, not exactly. If you remember, at the end of last year, Dr. Aziz gave us a report,
Okay, that's right, that's right.
and I
Okay.
used that report as the basis and then calculated the numbers and sent it back to him, and he said it was okay. Yeah, it looks kind of okay. So that's,
See, are you a lawyer too, then, not just a doctor? Okay, so, I see you had your hand up.
I think she raised the hand first. So.
Okay, Representative Miles.
Thank you, Mr. Chairman. Just a comment that I think retaining the bill is the best idea, specifically in light of the page 2, lines 1 through 6, where it discusses not needing a prescription for this medical device. So I think that's something that certainly needs to be taken up in the process of revisiting it.
Okay. Yes,
I think because of two reasons, this bill should be considered. One is that I don't agree the insurance company's definition of medical necessity, which is in the bill, is already somebody taking insulin. I understand that part. But the issue is that when you go to a doctor for diabetes or diabetes problems, the doctor doesn't see that. The doctor basically prescribes that based on the status of your how far along you are in diabetes, in A1C reading, et cetera,
right.
The insulin therapy is not the threshold that they prescribe this machine. They prescribe it before that also. So there is a big difference between the medical necessity definition from the insurance department and the medical practice department. That is something needs to be looked at. And right now, the insurance company keeps following the standard that they have put in place for medical necessity. And so that needs to be revisited with the definition of what the medical community or medical providers, they look at it as necessary to have this. That is one thing. Second thing is that this device, I mean, right now, what we are always struggling is that we try to prescribe, we try to cover this by insurance only when the diabetes goes to the final level, when you get into insulin therapy, which is the last stage of diabetes, basically. If you allow people to have this device, as is what medical community or medical doctors they recommend to use before, you might not go to that level of diabetes where you need a insulin therapy. I mean, diabetes is not measured just because somebody is taking insulin. There are 70% of people who are in grave danger diabetes, and their A1C is pretty shot up, but they don't take insulin therapy. why do you want to wait for people to go to that level when basically you have nothing, you can't do anything except take insulin therapy? So I feel that, like this bill was saying, that if the medical community, or if the medical doctor who is treating you feels necessity of having this device, then that device should be covered by insurance. That would be my argument towards it, to keep this
understand.
bill.
Okay.
Thank you.
Okay. So, yeah.
I'm not sure if we covered this in my notes. Again, this is a very small population, right? We're talking of the market that will be required to cover this. So we're really talking about a very small
Yeah,
population.
bring up the fact that it's the problem with it, even we mandate this, that large employers,
Unfortunately,
and-
it will just help a very small population.
Right.
But the question that I have is this covered under Medicare or Medicaid? I was just looking for guidance on
so
that.
what is it? You said it's still required under Medicare.
If you are checking your blood sugar twice a day,
Right.
In Medicaid?
and if I may,
You have to be on insulin. No, that was the thing see, that's why I said you threw a curve, because everything I heard so far in terms of my research on this was that it was insulin driven. And now you're saying, oh, wait, there are some people who take medications and don't have, like, I assume like my metformin that I'm taking, because I reached my 6.4, and another doctor says to me, "Boy, they're getting radical starting you, because usually you see all the commercials. It's we'll get you under 7, right? You get you 7. So when I'm at 6.4, why am I taking the metformin? Well, I'm taking it because I'm trying to be proactive about it. Okay, and metformin is cheap. Insurance companies doesn't mind covering it, so I figured that was a good thing to do. But no, I stopped taking my blood sugar. When I first diagnosed, I was taking my blood sugar, several times a day, just seeing what's going on, and then now I do it rarely. So that was really the issue with the threshold issue, is and that's what I'm saying. We're not saying we don't want to pass this bill. Okay, we are absolutely motivated to pass something. Okay, and Representative Sri said, we absolutely believe that determination is your doctor makes that diagnosis. Okay. The problem is that is the diagnosis is based upon because that's obviously a doctor-patient relationship. Okay, but that yes, the relationship in terms of what is being prescribed to that physician, what he's prescribing. And I don't know anything about these non-insulin things. I mean, I guess so metformin is considered a non-insulin bill you're talking about? So you're saying that I should be eligible because I take metformin, that I should be able to get one of these monitors?
I would say it would be unusual for a physician to recommend CGM for a person on metformin.
But they wouldn't need a prescription under this bill. But under this bill, they wouldn't need a
No,
doctor's
that
prescription.
would be deleted. That would be gone. No, it would have to be a physician. At the end of the day, yeah, the physician has to describe it. You have to, So, but anyways, we just want to know what exactly are the thresholds. I mean, what is the medical necessity? When does that physician makes that decision? And so, from what I was reading, was that if someone who's being tested multiple times a day needed to be tested multiple times a day because their blood sugar was bouncing around.
That would be true. That would definitely be a circumstance where CGM would be very,
Critical.
very
Very
valuable and
appropriate.
much
Appropriate, let's say appropriate.
But I would offer that is not the only circumstance. in
And
which
that's what we want to learn about, and to make sure that we articulate and spell that out in the legislation.
momentarily here for a minute for
Okay,
Liz Bennett,
you-
who's a practicing
We don't, we
physician.
testified already, so this is not a testimony. This is what we're trying to do, is work on the language. So you'll help us when we work on this language, that you'll help us, sorry. Oh,
Now, if that was his CGM,
that was, believe it or not, it is Brigham's Hospital. It's Brigham's Hospital. My appointment at Brigham's Hospital for something else. For something else.
And I just have a quick follow-up?
Yes.
Please, thank you. So then also in the bill is, to qualify for the coverage, the recipient must participate in follow-up care. So I just wanted to make sure that that additional follow-up care, at least once every 6 months during the first 18 months, access to telehealth, et cetera. I want to make sure that that's all covered in the cost and how that would work. Which
When you
is
do
on
when they
page
do a cost
2.
analysis, that, yes, it
Right.
means your multiple visits.
Correct, and I'm
Right.
not sure what the coverage would be currently, but
Right.
this would also need to be taken
I-
into account, so it's on.
I
page
believe, and based on
2.
when we looked at it, that most of the non-CGM related stuff was covered. I mean, go multiple visits and all that sort of thing for anybody with an insulin, not an insulin, a glucose problem does get monitored.
Yeah.
Right, I
by the
think the
doctor.
monitoring is absolutely necessary, but that needs to be, if it's additional visits,
Oh, okay.
how is all that going to be calculated in the overall?
Right. Well, I can just say myself personally that, that I do get my blood drawn, the fasting blood drawn twice a year. So that insurance, and I've never had any pushback from that. But that's the requirement because we were steadily watching my blood sugar, get up and up, and then they moved the goalposts back from 130 to 100, and
That's not,
it's not fair. So anyway, yes, no, that is absolutely, when we do our funny,
insurance coverage now.
no, yeah, right, now I'm in, right. So anyway, but I was in the small group, so I was acutely aware of the small group problem. Yes, Representative Teresa.
So I would suggest that, rather than debating that what requirements should be there to allow this as covered or not covered, and 2 times, like I said, or 3 times taking test and the readings are shooting up and down, who is going to benefit, etc. I would say that let's leave it to the medical doctor assessment of whether the person needs or not. If the medical doctor who is seeing the diabetic patient
Correct,
feels the need to prescribe it,
right.
it will be prescribed. And then if it's prescribed, the insurance companies, instead of keeping its own threshold, own criteria of covering or not covering, which is currently insulin therapy, should just listen to the medical doctor who is prescribing it and cover it based on the medical necessity as determined by the medical doctor. Not like, like you said, we had a couple of different criteria.
I can assure you, whatever we come up with,
Yeah.
absolutely, that key component
Yeah.
is that the physician is making that recommendation.
So that one line language itself will eliminate various different criteria should be covered or not covered. Just that one line will dictate whether.
I
covered or
wish
not
sometimes legislation could be just that simple.
Okay. Thank you.
Yes, Hope.
To follow up, and I'm sorry, not sure which of the 2 reps here brought this up, about where it says that a prescription is not required. We probably need to make that language more clear. What the statement, the full statement is, an endocrinology referral or prescription shall not be required. Because primary care providers can very effectively address this and we have a shortage of endocrinologists. Folks with type 2 who would benefit from a CGM don't necessarily need an endocrinology referral.
I agree. I agree.
Yeah.
Just as long as the prescription is in place. Okay.
Right.
I agree.
Again, that's the devil in the details that we need to work on. Okay. So is everybody comfortable with retaining? Okay, all those in favor say, raise your hand. 1, 2, 3, 4, 5, 6. Okay, so that was moved by me and seconded by, is he on health? Because then, I'm sorry.
Yes.
Okay, so are you okay with retaining this bill and the motion is to retain, so we're gonna keep working on it? Okay, so the vote is 7-0. Yeah. Right, well, this is, yeah. Okay, all right. Okay, so, um, okay, so I'm gonna wait on something because Representative Cole is not here. He's on housing this morning with Representative Gibbs and so let's just do 297 and then I'll clear out the room. 297. Okay. We're gonna do 297. So, like I said, that's Representative Cole, and so he's in the other committee. So, in housing, okay. So, okay, so this, yeah, I just want, yeah, we're gonna do 297 then, and then get rid of the room and then lighten the load here and then I'll call him down. So, okay, so I remember, okay, yeah. Watch the tape. Okay, all right, so we got, Sally. Okay, we got, Burrows. Beer. Yeah.
Okay.
Okay. Did we write a book here? Yeah, what are we doing now? We're doing 297. What's that? Yeah.
This started out as a little tiny.
Yeah, it sure did. Now it's a book.
Okay, you guys can
And
fight
it's
over
another
this.
Replaced, this replaces 176H. right?
Yes. Okay. No, it does not replace.
176H was.
176H would be
was
section
non-debate.
1 of the bill.
I took this one.
Okay, now, okay, that replaces that amendment number.
Oh,
Right.
this
Okay,
amends
so just so everyone
176H.
knows, so the way that this is written, we got, we still have the underlying bill. And which is section 1 of the bill. So section 2 is a new and unique opportunity that has turned into a book, a very short story.
If I may, Mr. Chairman.
Yes.
So DJ Betancourt, Commissioner of the New Hampshire Insurance Department. Let me speak to the length of the proposal at this point. So as I mentioned at the outset, this is a program that I very, very deeply believe in. I deeply believe in it because I think for a small amount of money, you can make a big impact for a lot of consumers when it comes to the affordability of their homeowners insurance. And also, and really this, if it is not being considered as part of the larger conversation, it really should be. You know, I know there's been a lot of discussion lately about what the state can do to encourage more housing and to be able to retain and attract a younger generation of workforce. And I know that that was a huge priority for Governor Sununu. It's now an even bigger priority for Governor Ayotte. And all of you in the legislature, I know, have worked hard on it and put resources towards it as well. But the piece of this not to be forgotten, as I think the vast majority of people in this room know, is you cannot get a mortgage from a bank unless you have homeowners insurance coverage. And if you're a younger person, that is not a small bite. When you're at the beginning part of your career, you're not at your peak earning potential yet, and you're really budgeting tightly. And I think that this is something that can be a useful tool as part of that overall effort that the state is currently engaged in. So because of my belief in the program, because I think it is a useful contribution to a larger policy issue you're trying to take on, I have engaged with a number of different legislators in a number of different capacities to try to make sure that I'm approaching this and that we are approaching this in a way that works for all of you. And so, as I mentioned, I think at the public hearing, when we first brought this proposal forward, I went and met with the legislative leadership and said, how would you like me to do this? Would you like the bill to be more broad and then we'll address some of the details in the rulemaking process? Or do you want more detail in the statute? And what they told me was they wanted as much detail in the statute as possible. So I said, okay, we'll do that. And then they said, we wanted to go through House Commerce first. So that's why the bill is at this point as large as it is. That is why you all are dealing with it. At the time they had said they wanted this to come through this committee, the filing period for legislation had closed, thus the non-germane amendment route that we ultimately took. And Mr. Chairman, I appreciate your indulgence in helping us make this process work. What I'm here to speak to directly this morning is an alternative manner in which the program would be funded. And I noted that when we were at the public hearing, the vast majority of questions that the committee had asked about were related to the finances. And having sat in your chairs not all that long ago, I appreciate the fact that you all right now, from a budgetary perspective, are having to weigh some difficult choices and some options. And I appreciated the fact that the $1 million ask that would come from the IPT that would ordinarily go into the general fund but would instead go to this program was going to be an ask. And I understood that. So I brought it forward. That was where your focus was. I have tried to structure this program as cheaply and efficiently as possible. As you know, no additional staff will be needed for this. We're really trying to run it very lean and very efficiently. So 2 Fridays ago, the department had its presentation before House Finance Division 1. And at the end of that presentation, I gave them a heads up that this proposal was currently being worked on by this committee, and that if it came forward, my assumption would be that it would be referred to finance. So I just wanted them to be aware. And it opened up a larger conversation in which it became very clear to me that the $1 million was just not going to be available for the program. So I said, I understand. You know, when I said that there are 7 to 9 states who have already implemented this program, had I known then what I know now in terms of the detail of this and the challenge of this, I would have said, but none of those 7 to 9 states have New Hampshire's unique tax structure, which I think is a very good one. Forces us to spend wisely and be innovative, which is what we've tried to do here. So in any event, a conversation had broken out amongst the members of Finance Division 1 in terms of the funding piece. And out of that discussion came the concept that you have here. So what we are proposing to do is to, instead of having an allocation, $1 million allocation from, again, the IPT that would ordinarily go into the general fund, we have said that, as you all know, our department is funded via an assessment on insurance carriers. It goes through a formula of the per capita written premium of that company. It gets a little complicated. Fortunately, we've got a lot of really smart people in the department who understand how that all works. So the idea would be we always assess what the maximum amount the department is authorized to spend via the line items in the budget that you all eventually pass. In the history of the department, almost never have we spent the full allocation. We budget wisely, and there are always some positions that are not filled, either throughout the course of that fiscal year or good parts of that fiscal year. So there's always some money that's underexpended. And so when that happens, my belief is we've budgeted wisely, we've assessed the companies for this, you give it back as a credit against their next year's assessment. So the idea that came forward from House Finance was use what you don't spend as part of the assessment up to $1 million, transfer that money into this grant fund, and then credit back the rest to the carriers for their next year's assessment. That was the concept. Again, as part of the discussion, we then included a provision in there that said that if, for whatever reason, the department spent such that there was not $1 million left over at the end of the fiscal year, that we would assess the delta between whatever was being put into the fund and whatever was needed to be put into the fund for the balance to be $1 million. So for example, if the department really went gangbusters and had a phenomenal year recruiting and filling positions, and we spent a lot of money, and we only had, say, $500,000 that we had not expended that fiscal year, the $500,000 would go into the fund, and then we would assess a $500,000 to make up the $1 million. I appreciated that that emergency provision would be controversial. Again, it was feedback we had taken in from House Finance Division 1. We want the program to go forward. Seemingly that would be a concept that would work for them, but if you're afraid of having us do an additional assessment, again, I think we can live without it. Number one, because we've never spent to the degree that we would need to do it. But number two is, I would be perfectly fine to say, if we only had $500,000 to put into the fund for a particular fiscal year, the announcement will go out and say, we're now accepting applications for the Granite State Home Risk and Resiliency Program. We have up to $500,000 in grants to give out this year. First come, first serve, let's go. Doesn't have to be $1 million. So if you want to take out that particular provision, again, I
So
have
we
no
could
problem.
call it a pilot program.
You could call it whatever you'd like, as long as it goes forward, Mr. Chairman. So, Mr. Chairman, as you know, we were hammering out the final details of this amendment as of the late morning hours yesterday. And so we got it to Representative Hunt as soon as we were comfortable with it. As we always do, we then sent a copy of it to industry. I have not gotten any feedback beyond a very brief conversation with one industry representative as I was coming in this morning. My understanding is that they're concerned. So, and it seems that it's less concern, they're equally concerned, I guess, about both aspects of what we propose. I'll be candid with you, I was a little bit surprised that they objected to the first part of it. I thought there would be some pushback on the provision that allowed for an emergency assessment, which again, was not something that I felt was absolutely necessary for this to work. I don't know the full details of those concerns. What I can say is that we did a very rough calculation of what $1 million would mean on average to a company in terms of the credit towards their assessment. And the very rough math figures came out to approximately, again, because it's pro rata, it's going to be different for different companies, anywhere in the neighborhood between $40,000 to $80,000 per company. And by the way, my understanding is that industry treats their assessment as a sunk cost, because there's no guarantee what they're going to get back at the end of every fiscal year. It depends on how we budget. So from my view, this may very well be a case where we're going to agree to disagree with industry. We work hard to try to find consensus. We always work collaboratively. And I appreciate the fact that it came together late so that we didn't get the ability to get full feedback from industry. But there's obviously a ways to go in this process. There'll be an opportunity for that. But if they fundamentally disagree with the idea that we would be able to retain some portion of what we did not spend in our budget for this program. Again, that's just going to be an instance where we have a difference of opinion, and that's okay. So that is what you have here. I'm happy to get into details. I can do the musical chairs, or there's a very big chair with members of my team if you
Well,
want to get into.
if you want to just pull up a seat over here, and,
Sure.
and I'm sure George will love to share with us. Right now, George. So yeah, yeah. This is a subcommittee. This is not, informal. Right? Remember the old days where I used to we would all sit at the far end, one end of the committee room and, okay, so just, yes, Representative Spear has a question.
When when last we spoke about this bill, the funding mechanism was the taxes that are paid on the licenses, is my understanding. I could be totally wrong. The taxes that were paid on the licenses would fund this program, and now you're talking about an assessment. Can you explain what the difference is?
Sure. So, again, as we thought about this program, we discussed a couple of different ways to approach the funding of it. Initially, my preferred funding source was what the state of Oklahoma does. So the state of Oklahoma takes all of the licensing fees, registration fees that they collect for surplus lines companies, and they put it into the fund. That's become their direct revenue source for their program. And I said, that sounds pretty good to me. Until I found out that in New Hampshire, we only generate about $38,000 worth of registrations for surplus lines companies. I'm not going to get very far with this program with $38,000. So it forced us to have to consider a different option. And we went through a couple of different options. We appreciated the fact that some of those options were going to touch a nerve for industry. We wanted to see if we could thread the needle to get everybody on board. So I said, look, we will come out of the gate with a proposal that will let us retain the first $1 million of insurance premium tax revenue that we collect and put that into the fund. Industry, I don't want to speak for them, they could speak for themselves. My understanding was the industry was fine with that approach. Then, as I've said, who was not fine with that approach was House Finance Division 1. And I understand why. I understand the challenge you guys are going through. So based off of their conversation about this, now has come forward this proposal. So directly to your question, again, when we first started, it was $1 million of IPT into the fund. That's straightforward. That wasn't available. You guys need the $1 million for other things. So the assessment piece of it is, again, how the department is funded. We're a self-funded agency. So we take the total amount of the department's budget, what we're fully allowed to spend for that particular fiscal year. So it's somewhere in the neighborhood of 15 million that we're proposing for the budget that's currently under consideration. So that's what's going to go out. It'll go through that formula, per capita written premium for that company. The check comes in, there it is. And so what we're saying is, if we don't spend 15 million, the full amount that we've been authorized to spend, we can retain up to $1 million of that and fund the program that way, which is a stable funding mechanism going forward. Yes, the amount might change. I don't really think we'd ever get below $1 million, but I'm not going to be commissioner forever. But the other benefit is it does not have to go through the budget process every other year and have to be weighed against all of the other priorities that you have to consider.
But what does the term assessment mean in this context? The word assessment. What are you assessing?
We're assessing the insurance companies who do business in New Hampshire.
Okay, yeah.
I've done a lousy job of
she-
explaining this
she-
now 2 weeks in a row.
She's a little new.
No, that's
Okay.
fine.
She's all,
I'm a little what?
you're new. This is your second term.
Yeah, I don't know
Okay.
what the word assessment means.
Exactly.
Go for it.
So, anyways, Vermont, they pay for the insurance department out of the general funds. Okay, all the expenses, to pay for all employees, pay for everything. Okay, and they do that for insurance and banking too. Okay, we don't do it that way here in New Hampshire. And here in New Hampshire, we expect the users of a department,
Like the insurance companies.
like the insurance companies or like the banks with the bank, the users to pay for the departments.
I see.
And so the assessment system is created, and it, when he was talking about how we have rocket scientists figure this out, like you, okay? Because there's lots of little formulas. It's like the Dow Jones, you know, and when you come in and it's a different number, you know, and it's complicated because it's based upon the type of industry, okay, and you know whether it's property and casualty versus health insurance, so each one's different, okay, and that we have an assessment system that we make anybody who is a domestic insurance company pay the lion's share. We definitely try to get all the other property and casualty companies that participate in our state, and we're very have a very lively property and casualty because we don't have mandatory auto. Okay, so we have a good market of a lot of companies that come in and do business. They pay, you know, they get their assessed. Everybody gets assessed to help finance the department. So that's what he's talking about. But that is, we have to be proactive. We have to assess them first based upon our budget. But then, and when all said and done, after the year is over, there could be employees we didn't feel, jobs didn't happen, different things that could have happened in terms of that year, and that's why there's often a surplus. And that's what we're tapping in, is that surplus normally would be just apply to payments for next year for those in companies. But we're saying we're going to carve out a little bit to help this property and casualty industry. Yeah.
Thank you. I just have a quick question, Commissioner. Can't see you.
Oh, I'm sorry.
You cite in here, you know, it sounds like the possibility of federal grants or money. I assume that's close to nil possibility at this point.
I would never dare to predict what's going to happen in Washington.
I think we can right now.
So it's in the bill simply that if there was, then they wouldn't have to come back. They
Oh.
wouldn't have to come back and ask permission to take the money.
There has been conversation about the federal government making grants available to states for either the promotion of these programs or to help supplement the state funding. And I think it would be a great thing if the federal government were to make those grants available. We would obviously be able to expand the number of people that we would be able to help. The key question would be, beyond whether or not it was actually ever made available, the other key question would be, how many strings do they attach to those dollars? And would that work within the constructs of our program? And if the strings were common sense, but it still didn't quite fit right, I would come to you and say, we need to make a couple of tweaks here so we can get these federal dollars in. But if it's too overwhelming, we may not be able to make use of them. So when I've talked with our federal delegation about this, I've said to them, I think those grants could be very helpful to states. I absolutely believe in the benefit that it could provide to consumers. But please, as you make those grants available, do not make the requirements around them so prescriptive that they don't fit or can't work within how each state has structured their program.
Okay. We'll get to you, George. I promise.
That's all right.
Representative Priscilla.
Thank you. So I've been trying to research the purpose of the program is to lower insurance costs for property owners, right? Property insurance. And I've been trying to research.
No, it's not lowering. What this is preemptive.
No, I
you're
understand that,
you're
but the
trying to
rate,
be
he's trying to get the
preemptive.
rates to come down, is what I've been hearing.
Yes, if I might.
So I'm not seeing the connection between cutting my trees down and, right, I might not have a claim for that, and having insurance rates maybe be a little bit more competitive.
Sure. So let me explain how this would work, because Representative Hunt's right. This is a prospective looking program, not anything that would be later or post-event, those would be things that FEMA would get involved with. The way this program is structured is when you are getting a quote for a homeowner's insurance policy, or when you've come up for renewal for your current homeowner's insurance policy, they're going to put you through an underwriting process. Each company has their own underwriting factors. Those get looked at by the department to make sure they're not discriminatory or anything of that nature. And so they'll look at your property, or they'll take an aerial photo of your property, and they'll plug what they see into their underwriting formula, and then it will spit out what your premium should be. And there are things like value of the home. There's a number of different components, but some of the components that we've heard as of late that have driven a lot of premiums upward are things related to the property or the external part of the house, roofs, those trees I was speaking of, being able to shore up the foundation to guard against flood. And so what the program is designed to do is to speak to those underwriting guidelines. So the eligibility of what you can use your funds for is directly tied to an underwriting factor. And so when you come up for renewal, you're going to be in a better position if you've fixed the roof, if you've done whatever needs to be done, because you're going to fare better in that underwriting process. And so your premium ideally would come down. But at worst, our hope is that it will prevent you from not getting non-renewed and having to go try to get coverage through the surplus lines market, which is very, very expensive. Does that hopefully answer your question?
Well, that's, I don't, but yeah, I'll give a story. You know me, I love stories. Okay. So let's say, your company, the insurance company says, we would like to do a visit. We want to come check it out. And you're there, you see the guy is coming in and he's looking at it over, and he's got his clipboard and he's checking things out. And then all of a sudden he looks up, and you have your children, they're on a swing under one of the limbs of this tree, swinging back and forth. And he looks up and he says, "That's a very big tree." And then he writes something down on his board. And your first instinct is, he doesn't like that tree. And that he might, when it comes time to set your rate, say, it'll be a little higher because they see a risk there. So what this bill would say is, now obviously this is not set. I mean, there's not, I don't think you ever get a letter that say, cut that tree down or we're not going to, give you insurance. But you just sense that, I know that tree is a problem. But I never dealt with the tree because it's going to cost me 10 grand to take it down. Because you have to come over with this big crane and pull each limb off separately. And so this is a program in which the New Hampshire Insurance Department is going to really help you.
Never had a little person, and nobody on my street ever had a little person come out and with the clipboard and assess.
Okay, all right. So
This is a new.
I would
a lot
have to
of,
say is, every time I get a new insurance policy, and I've had a couple, I had this thing come out, and one of them came out and said, "You have 2 dogs." I said, "Yeah, I got a beagle and a black lab."
And
They
let
got
me
canceled.
And let me.
Well, this program won't help you, I'm sorry.
Get rid of the dogs. Right?
Yeah, we're not expanding criteria to get rid of dogs.
So-
Representative Porcelli.
I'm happy about, keeping your budget related to fund the program, to be
Okay.
perfect.
We gave back $2.6 million last year. So they'd still be getting back under that scenario, they'd still get back 1.6. And the other thing too, Representative Porcelli, a lot of times the reason you don't see somebody in person coming out is there's been a greater reliance on aerial photography from companies, which brings with it efficiency, not having to bother you, We sometimes run into some challenges with accuracy of the photos. We had a consumer quite perplexed that they were non-renewed based on the condition of their property, and the photo they got was of their neighbor's property. So we had to do a little outreach to the company to say, you got the wrong house. But that may be one of the reasons you don't see.
So that would not be one of our New Hampshire domestics, right, George?
Possibly,
No, right. Okay, George, tell us what's wrong, what
thanks.
your issues are and whether we can
So
fix this.
thanks.
or
I
not.
think I know all of you because I've been testifying, but George Russo's is my name. I'm a lawyer in Concord, and I represent different insurance associations, along with my partner, Lindsay Nato, who has also testified, I think, before you. And so when we first heard about this initiative from the commissioner several months
You wanna
ago,
speak close to the mic, I'm sorry, just pull the mic to you. There you go.
our first concern was funding. Because it seems a natural thing to say, well, here's the program and it's going to be funded by, let's say, existing premium tax dollars, which was the way this bill was originally drafted, and say, well, wait a minute, why don't we just raise new money from the insurance companies instead of having $1 million less into the general fund? And so that risk was paramount, and we expressed it to the commissioner. And as the commissioner mentioned, we had no objection to the original bill, but again, very concerned about the funding. So sure enough, what happened, as the commissioner outlined, is he went before finance and they said, well, this bill is going to cost the state $1 million that it
Evidently, we don't have.
right. So, so here we are. And I want to thank the commissioner. He's been great at working with us, communicating with us on this and other issues as well. And we almost always find agreement on matters of public policy. And here the commissioner let us know about his hearing, meeting with finance and the prospect that they're looking for funds. So here we are. We sent it around yesterday afternoon, and we've gotten a lot of feedback between yesterday afternoon and now from companies expressing concerns. I'd like to first mention, so we're clear about the taxes and fees that insurance companies pay currently to the state of New Hampshire. There's a premium tax that varies from 1.25 to 2% of gross premium that is paid. Before that, insurance companies pay a BET, the business enterprise tax. Then they pay the premium tax with a credit against the BET. And then a business profits tax to the extent that the premium tax is less than the BPT. So they pay the higher of the business taxes that businesses pay and the insurance premium tax. In addition to that, as the commissioner mentioned, insurance companies fund by assessment the budget of the insurance department. That budget is roughly $10 million. It keeps going up, but around that amount of money. We're one of only, I think, about 7 states that fund the department by assessment rather than through general fund. That number may change. I haven't checked in a long time, but roughly that number, a minority of states. In addition, insurance companies pay fees, licensing fees and so forth to the department. That again, these are rough numbers, but the last I knew was a couple of $100,000 a year to the department for its services, even though those services are already paid because the budget's fully paid for by the assessments. In addition, insurance companies fund the workers' comp division of the Department of Labor. And so it is highly taxed to begin with compared to most corporations. This bill is a new tax of $1 million.
Well, you just killed it.
Well, that's what it is. It
George, I always thought you were a nice guy.
No, we support this initiative. But to charge premium payers, because that's where money to pay taxes and everything else comes from, for a program that benefits, it doesn't benefit just insurance companies, but it benefits the general public. That's really the reason for it, is to improve, promote home safety. And by the way, the assessments that would pay for it under this amendment apply to not just property casualty insurance companies, but to life insurance companies and other companies, HMOs and so forth, that pay the assessment.
But isn't the assessment variable based upon which industry it is? I thought
It's,
there was
no,
a-
the premium tax is,
Right.
but the assessment is you
Is
you
equally
take the,
proportioned?
as a denominator, the total premium in New Hampshire, and then the numerator is the individual company's premium in New Hampshire.
Oh, how much they do,
But how-
economic business they do in the state.
That's
Okay.
correct. That's correct. So this struck a sensitive nerve with insurance companies. Now, you can say this isn't a tax, it's an assessment, which is a fee to pay the budget of the insurance department. But a fee, as you know, has to be constitutional. It has to be related to the cost of the services being provided. And here, there's no relationship between the home resiliency program and the fee. So it's either an illegal fee or a new tax, depending upon how you characterize it. So you say it's $1 million. Well, it's $1 million today. That's fine. What about other states? Now, these initiatives are coming up in other states. I think the commissioner mentioned 6 or 7 states that have a program similar to this one. States talk to each other. And if this is passed and there's an
If the
assessment,
word got out that we did this. then
yeah, then other states are going to be
think
inclined to
quite
do the same thing.
Okay.
So that's a concern. In addition, and gets a little bit complicated, in the world of taxation, reciprocal taxes are
Yes.
only exist with respect to insurance. And the way that works is the states say, if you charge a fee or a tax to our Indiana or Illinois company in New Hampshire, we're going to charge that same fee and that same rate to your New Hampshire companies doing business in our state. So it's a tit for tat situation. And so a lot of times when these taxes and fees are implicated, it not only costs the $1 million that we pay to New Hampshire, but every other state has the ability to retaliate and to charge us for the similar program as though they had a program in their state. And so you multiply the exposure that a company has to retaliatory insurance taxes. That's another concern.
So, yeah, obviously, you and I have been around
Yes,
this issue.
right,
Because we tried to lower the premium tax.
yes.
And what is our tax rate now?
It's a 1.25% for
Okay.
property casualty companies. It's 2%, I believe, for health and life.
2%
companies,
was
but-
still, they maintained the 2%. But
Yeah.
we got the 1.2. So the fact is that we could have, that because of the reciprocality in terms of what happens and that, you know, the fact that we lowered our rate, that had the effect of even for all those other companies who were doing business here. So it has been a revenue decliner. So if you were not sitting in this room, but sitting over there in Ways and Means, you would say, why in the hell did they lower the premium tax?
Sure.
And look at the implications. So they probably wouldn't take this bill lightly, given that we've already taken money out of their pocket, so to say,
We do go back. This goes back to 2006, and it seems like yesterday. But
for you.
So,
Because it was a hard fought battle.
It was that.
It was a hard fought battle.
yeah,
I have a question.
Yeah.
for you. You said that because this is a fee, I have two questions.
sure.
Two,
You could
one
ask
for
as
you
many
and
as
one
you
for
like.
him,
Yeah,
based on something you've said.
yep.
You said because this is a fee and it doesn't directly affect the business because it's homeowners and whatever. And I question that. If that tree falls on the house, you have to pay out.
Sure.
So this definitely mitigates future damage that you're gonna have to pay on. So the fee is definitely within scope of your business, is my feeling about that.
Yeah.
Or if it slides into the ocean, that's even worse.
The fee we're talking about is supposed to be related to insurance regulation, not to insurance payments or premiums, but to the activities of the insurance department. That's what we pay for because we're regulated by the department.
Okay, then the second question
It's
was.
it's a separate
Well,
question.
that is the fundamental issue is that
Okay,
we're
I understand
talking
the
about,
difference.
that's why I brought in banking. To say is, okay, this is not the only department we do this with. We do this with banking also. That we created this regulatory authority for the purpose of creating licenses, and you know what John Hunt's rule of licensure.
Oh, yes, I know that.
Okay, so we can take it away from you, but then now we got to pay those bureaucrats. We got to pay those people. We got to pay the department to do what it does. And this is how we made the decision that we weren't going to ask the taxpayer to pay for it.
Okay,
Because
but
it's
I,
really consumer protection. It really, consumers, pay
Yeah.
for the AG's off. But in this case, in these two departments, we ask them to fund themselves.
I would like Mr. Betancourt to answer the question about the taxes. And can you verify what he was saying about taxes?
So George and I obviously have a bit of a difference of opinion on this. What I would say, though, is the argument that this is somehow a new tax, I don't think is accurate. The assessment is currently in place. That's not changing. There were some people who had said, why don't we just have in the bill that you'll separately assess the companies for $1 million for this program?
Just the property and casualty people.
Yes, there was that suggestion. And I said, I don't like that idea for some of the reasons that George talked about, because I think at that point, it does start to take on the feel of an additional tax, which I don't support. And secondly, I'm always very wary anytime somebody comes forward with a proposal to address their particular program or issue or challenge via an assessment, a separately made assessment on the companies to address that problem, because then you've created the precedent and everybody's going to come forward and look for their particular issue to be addressed that way. So for those reasons, I said, no, we're not going to do a separate assessment. What we're going to do instead is to retain what we don't spend up to $1 million. Because again, there's no guarantee what the companies are going to get credited back for at the end of the fiscal year or what they were assessed. So
But the original bill was that they didn't have any skin in the game.
right. They really like
Because
that.
all,
Yeah.
because all we were taking the money from is from not anything to do with assessment, but doing with this, one of the few taxes we actually do have in the state,
Mhm.
which was the insurance tax.
That's right.
And so
And that, by the way, is
so,
still my
so the
preference
companies
today.
well, I understand that.
But-
So basically what, the companies are saying, well, that's very nice of you guys willing to do this favor to us to help, to help people, premiums. But the money you're using is out of this other tax, which they've already done their best. We've already lowered the tax, much as, some people might disagree. I think Representative Almy, I don't think was too happy when we proposed the decrease in the tax. So I think that in hindsight, I'd say this is not the time for this legislation. Yes, it's well intended. The initial cause, or I guess we could say, is would have been great when we're flush. But, when the revenues were coming in, or let's say, we could have done this in lieu of cutting the tax back then when we did it. But at this point, I think it is kind of hard pressed to use the assessment system to fund this pilot program.
So if I might, Mr. Chairman, to that point, I'll share the same thing with you that I shared with House Finance. If that's the position that you all want to take, then let us draft up an amendment that would establish the program, would say that the way it will be funded at present is for any federal dollars or individual or contributions of any kind. Should they be made available, we could just drop those dollars into the program and be ready to go, rather than having to potentially wait to come back to you to get the program established while the federal dollars are sitting there. We can give you an amendment that it basically establishes the program,
Okay.
keeps us open for business should those
If,
funds
if
become
there
available.
was, if you could identify the funds, I assume George, are you,
Yeah, yeah,
you're the
I-
lawyer, are you okay with that?
Yeah, I like the idea. I wish that, part of the problem is that this came upon us suddenly. We really haven't had time to fully discuss the issue, but I had been thinking about that and talked with Lindsay and some of the companies about doing exactly what the commissioner is suggesting right now. Get the structure in place. You've heard the merits of the underlying the program, and so that work has been done. And to allow grants, I think that, and the commissioner knows better than I do, but I think that there was, what happens, nobody knows, but that there was some serious interest or belief that the federal government was going to step in and provide grants to the states in this area. Who knows whether that's going to happen? But I say that because a number of the states that enacted mitigation programs like this one do have a provision in their laws that calls for accepting federal grant money. And in addition to that, again, I can't make any promises, but I think that this would allow the opportunity for private grants. Insurance companies may wish to participate in the program. I can't speak for that, but we support the commissioner's initiative in this. So if you did, as has been suggested, get the structure in place, wait for a better time, and see how that works. And in the meanwhile, allow for the possibility that there'll be other funding that can start to seed the program to go forward.
And I had a private conversation with Representative Weiler in which he had said he was very comfortable with that approach as well.
And the former commissioner? Okay, why don't you come over, speak to this one? Like, we're all done with George. We're all done with
The
George.
Association of
You can
Mutual
go on.
Insurance.
I wanted to
Companies.
see those
You've
two
done your
squeezing
damage,
together.
George. Move on.
Yeah, this is exactly, and when you mentioned it may not be the right year, I was hoping that the commissioner would offer to let the bill go forward. Rhode Island just introduced a bill that doesn't have a funding mechanism, just to allow for grants. I think there is some thought that Washington is looking at other ways to better use federal granting, and some of this prophylactic kind of pre-planning is more aligned. And so I think this underlying fortified home program is worth passing. But with George, we agree on the funding. Thank you.
So I have a question. So under this program, if a person gets the grant
Right.
to cut the tree, for example, like you said.
Yep.
So does he have to pay back that money?
No? It's a grant.
So the question.
It might get a 1099, right?
Yeah. So that raises a question about the. See, I don't have a problem with the objective of this program, but the implementation part, when you mentioned that it's first come first served basis.
Correct.
So now, once this program is in place,
Yes.
and obviously people who would be knowing about it, they are going to apply. And first question would be that how the insurance department or whichever department is going to oversee this, how are we going to make a criteria to give, how much to give, or
That's
or
actually
to
in the
give
bill.
or not to give.
That detail is actually in here.
But the most important thing is that once you allow someone to get it,
Yes.
and now you say the second person applies for it, and you say the fund has run out. I mean,
That has happened with every, take this solar exemption. The federal government, yeah, there's a limit to you can get it and then and they run out of money and say, no more this year and wait till next year.
so
Yeah, that happens. with
I
these
see that,
government grants.
I see that under this program, there could be a lot of situations of misuse of this program unless it is administered properly.
Yeah.
In general, I have reservations. I mean, for all due respect to all the government officials, in general, I do have reservations of government running businesses where you provide certain grants, unless it is done appropriately with all the welfare officials in place. There is a situation where this program can be
The
misused.
good news is it's only 10 grand, so you're not going to have anybody running off with a lot of money with
Well,
10 grand. But yes, I hear you that but my take on
10
it
10
was
grand is a big
my
money.
take is a lot of people won't do it because that they don't really want to lose that tree. They love that tree. And certainly won't get rid of their dogs.
I mean,
So I would say is that it is a case where it's trying to be proactive. Okay, put yourself in the department's shoes. That they get these calls. Every time there's a bad weather event, they're getting calls where people are upset that they're this whatever their claims or whatever happened with the wind and ice or hail and all these wonderful things that can happen. And I'm sure some of the cases they go very, how far to go? Well, I got that ice, because of the water, I got ice and I broke my back and, went medical coverage, who knows how far people will go, make these phone calls. And the department's just saying is, what can we do to at least make sure that no underwriter shows up to your property and says, boy, that's a big tree. that it maybe, it give people an opportunity. And I know myself, my summer home, this is not true of my home, but my summer house, I had these trees that they're really old trees and they're all starting to fall down. And some of them right are on the power lines. And I keep saying, that's got to get fixed. But every time I've called the utility, let's wait till it falls down.
yeah,
first.
but in that situation, when those trees are anyway dangerous to the house, you don't want to postpone cutting those trees just because insurance is not covering it or so that's why you're not
Well,
getting
that's what I'm
grant.
saying. This is the
You
insurance
have to do it
company-
anyway because it's going to be
You should
hazardous.
be doing it anyways.
Yeah,
That's
if it's
correct.
hazardous to your own house,
This
your own
is-
safety.
This is an idea to be a motivator.
So in that case, I'm going to apply for a grant and get free money and get that done, which I would have done anyway.
well-
That's the thing I'm seeing that.
Okay, so you think we shouldn't do this at all?
I don't think that there's a requirement for this program.
There is no requirement for this program. This was, I mean, maybe he's just.
No, I mean, we are just
You can tell us
increasing-
why this, maybe I'm not doing a good job here, but help me out
I
here.
think we're focusing on trees because they're simple. The vast majority of this program isn't about trees. It's about building and rebuilding your roofs and your structures to the IBHS standard, which is a fortified home standard. So much of this grant money will be used to put better roofs on that withstand windstorms better. And so, though I think the commissioner was wise to allow for a wide range, most of this money will be used to incentivize consumers to do the better roof, so that we as a state can look at how those roofs fare in the next large storm. And so then we'll come back in 3 years and say we had a bad windstorm, we had a microburst, and there were 5 houses in that microburst area who had the IBHS fortified roof. Did it do better?
Why don't you
this
explain what
IBHS is in the insurance
international
building,
home builders requirement?
insurance building and home safety, which is an organization funded by the insurance industry so that we can do this learning. The commissioner was also very smart. In his bill, he put pretty strict income limits so that this isn't going to just be a boon to rich people who want to fortify their roofs. These limits are such that it will be helping the lowest income homeowners in New Hampshire. And I think we have to give him the opportunity to figure this program out, have a few grant rounds go and see how it works, and we'll come back. The initial results from the Alabama Fortified Home Program have been phenomenal. Now, we have different cat
Yeah, but
losses
they
here.
probably had all this, didn't have the proper,
Not even a question, that,
yeah.
that their roof systems are different.
tin roofs.
But yeah, the industry supports fortified homes and the test here. Thank you.
And if I may just add to that, the word incentive's been used, and surely it may very well incentivize some people to do those improvements. But I want to make sure that in the term incentivize is not lost the fact that some people would absolutely take the steps to address the roof or the tree, whatever the issue may be, if they had the financial means to do it. I mean, I'll embarrass my parents a little bit. My parents had a very large tree, beloved, but it was dead, that because of how close it was to their home, it was going to end up costing them about $5,000. And they're on a fixed income. Their favorite son helped them to be able to do the work. No, I'm the only boy. The competition wasn't tough. But I helped them with the cost of it. But what it drove home to me is that there are people who would absolutely want to do the proactive, responsible thing, but simply don't have the budget to be able to do it. And so, to the extent that this program could be leveraged to help them bridge the gap between what they have to contribute towards that and what it is going to take to complete that work, then again, I think we've opened up a door of opportunity for people to not only, again, I'm an insurance guy here, so I'm looking at it from that perspective, but not to be lost in this whole conversation is the fact that the home and the property is going to be physically safer so that you're not having people in danger or at a greater risk of danger. And so I think all of us would, if resources were no limit, do everything we could to make sure that our property and our homes were as safe as they possibly could be.
Okay, so what section is the financing of this, in this bill? Sorry.
Yes, so, Mr. Chairman, just to help, it is page 9, and it is the bolded material, so the bolded material.
Roman numeral 7.
Yes, that's right. So again, Mr. Chairman, if you were willing to allow us to move forward with just the establishment of the program, but you wanted the funding mechanism to be, I think the technical term for it is to accept donations or funds. That's what they call federal grants that are made available for accounting purposes. We could get you that language by the end of the day today, and you'd have it in plenty of time for the full executive session.
Well, okay. Yeah, actually, at this point, I don't even think that this is an early bill anymore. Because if you're getting
Because
down
we're
to it,
funding.
so you're taking all the funding out, so some of the urgency's out of there. No, I wouldn't retain it. It's,
You could take what time you'd like, Mr. Chairman. I'm just telling you, I could get you the amendment you need by the end of the day, and then you can
yeah, okay.
do what you like.
I mean, how do people feel that we would
Yeah,
take?
we do it. I think we should do it.
Yes, Representative Miles. Okay. Oh, the original underlying bill.
Works all my life and help
Oh,
people
that
have
was the
left.
first paragraph.
Yeah.
That's still in.
Yes.
feel like that maybe, being a little cynical. Sorry.
Yeah.
So allowing them to have their claims data, I think even maybe I'm being a little cynical, but it's not that hard to drill down to figure out like if you only have a few employees as a self-funded employer, you kind of already know like who your people are and if they're sick and who's probably using the most insurance and costing you the most money. So I feel like allowing them to have their claims experience could be ripe for wrongful termination suits.
I believe in the statute it says that would be illegal.
Well, of course,
Right.
but that's That's my concern.
Yeah. Well, that was,
I'd like
that
to
was
make
the
a
reason why it
comment
was
on
always
that.
part- That was why.
I worked
they-
over at BAE.
Well, you're the sponsor of this bill, so you.
Yes,
She's
I
going
worked
after
over at
you now.
I worked over at BAE for many, many years. And the HR department knows exactly who goes out on medical and what they're going out on medical for. They don't really start terminating people based on the claims data. That's just an actuarial thing that they use. They already know, and as a matter of fact, in order for you to come back to work, you have to write a note and get a whole doctor's explanation. So, and I think that most employers know what their people are doing and why they're going out. So
I agree.
I don't
So
think that's a
therefore, I don't
problem.
think they need any more of the people's personal health information.
Right, so
And-
this was a department bill, right? So, yeah, why don't you defend it? Don't, make her have.
We're going to have Dr. Assis come back to deal with
Oh.
this. That's a level of detail that only the
Yeah,
math
but,
geeks
You
know
have
best.
the original language?
This is his bill, right?
Okay.
It was in the first paragraph.
Yeah.
All right, the carrier administrator shall also notify the employer that if such authorization is provided, the commissioner shall provide the employer access on an annual basis to the claims data associated with that employer-sponsored plan.
And it says experience, and that's very specific information.
Right. I would agree with Representative Miles because see, they might not terminate based on that reason. They would never say that, oh, I'm terminated because of your medical history and claims data. But they could use that to determine some other reason, like performance or this or that, and that could be a factor. But my question would be that more that what is the need for an employer to even get to know this data? Why employer need to have a claims data information?
Okay, so my understanding is, who called me on this bill? Nobody in this room. Okay. Yeah, I think it was Henry Vayu. And the issue was if you want to shop, if you're a small, this is not a small, well, you're a large employer. You're in an ERISA plan. Okay. And you wanted to shop, that you wanted to have access to your claims data so you can use it to shop. Was that what this was about? With my memory, that's what this bill was about. It said you're using it so you can shop around. If the carrier was willing to, share it. Well, it says the carrier or shall.
So I think what we have,
Right, so if the carrier doesn't want it, yeah, but if the carrier didn't want you to shop around, they could say no.
no, the company. I think we're
Oh, the
talking company here. And so I think we have to first establish New Hampshire has the best claims database in the nation.
Right.
Claims database that helps us do the analysis that you hear from Dr. Aziz. That helps us educate, helps the commissioner educate consumers about the cost of medical treatments and where they're delivered. The best in the,
Yes.
and the best in the nation.
We've done,
One
we've
of
really
the
perfected
one
the
of the
art.
holes there, and it's a hole that's growing and it continues to grow, is that self-insured groups do not have to participate in the claims database. And so this is a carrot and a stick to say, self-insured groups, if you'll help us collect your data, if you're willing to have us do that, great, right? And that's what we want. That's what, as a state, we want the best claims database. In return, we'll give you some data back so that you understand what portion of your fully insured expenses are your claims data, as opposed to administrative expenses, as opposed to other costs.
And I would just add to that, because I think what Representative Miles was concerned about was, is there proprietary
Correct.
or
Or
protected-
identifiable,
protected
identifiable
information.
information.
I'll use that
yeah.
broad term, protected information that would be made available to the company as part of the carrot stick approach to get them to voluntarily give the data, to which I would say absolutely not. We have very strict confidentiality requirements currently in statute. What that would look like is anything that could be anonymized and aggregated. It would not be specific to X, Y, or Z employee. That's protected. That is currently protected. We have a lot of very sensitive, protected proprietary data that we collect as a department at present. But because you've got those confidentiality provisions on the books, it dictates how we're able to share with the public the data that we've got.
So are you saying that the data being provided will be an aggregate data?
Yes.
And not per employee or per
Oh,
person
yeah,
basis?
absolutely. It's gotta be aggregate.
That's right. There'd be all sorts of violations if you started getting into any sort of identifiable information
Right.
or the
Key thing is
conditions
you
of the
can't be
individuals.
identifiable.
Yeah, that's a very, very clear, long-established
Okay.
no-go zone.
Would you consider a minimum number of employees in those self-insured plans? I
Well,
mean,
these
you
are all
know,
risks anyway, so they're gonna be.
I mean, but if, like, they can be 20 employees, and that's not hard to figure out aggregate data on 15 employees, 20 employees. It's not hard for the CEO to figure that out and to know
Just need
this
to-
person's about to cost me $1 million this year.
In a scenario such as that, I mean, I think that risk is present regardless. If you're a company that small, you know, and somebody's become pregnant, I mean, it's going to be obvious. But fortunately, we've got non-discrimination laws that would
Yeah.
prevent that person from being let go for that reason, of course.
And let's be candid, if you're a 20 employee employer, your option is going to be to go into the small group market.
That's right.
So if you had the shock of $1 million
Well, you're-
employee, you're going to shift next year to a small group plan.
That's a
it's
level
gonna
of
be-
risk you wouldn't want to retain as a business of that size. And I've talked about this before, not only the small group market's going to be the more attractive option, we are seeing a pretty steady migration of those small employers from small group market into a version of the individual market called ICRA. It's an acronym. I can never remember what it's an acronym for, where the employer will give the employee a set amount of money. There are tax advantages to that money. And then that individual employee goes onto the individual market and purchases a plan for themselves. That's another huge trend we're seeing for businesses of that size, Representative Miles.
Yeah, it makes sense what the gentleman back there said about they'd obviously shift in the upcoming year and not have ongoing.
Right. He's a smart guy. I like him.
And if we had Paula here, we would have 3 commissioners in the room at the same time. Okay, you feel better about it? How do you feel about it?
I still am not clear the purpose of providing that information data to employer. Only part I heard is that helps employer to do shopping around.
Well, I
to
was
get.
wrong. I was, it wasn't intent for shopping around. It was more intent, I guess, in terms of why we have this database, you know, is.
So I'm still not clear why there's a need for the employer to get the data from the insurance company.
That was-
Besides the fact that, like you said earlier, that, he might use that information to shop around to get a lesser premium, which is not the case apparently.
Well,
Then
he
what is
can't,
the
well,
use of
no,
that?
he can absolutely use that for that purpose, yes.
He can
but-
use, but see, sometimes I guess we try to pass bill or try to discuss bill that is not even necessary. I mean, like I said, I'm still having hard time understanding the need of providing that information to the employer.
It's going to help them identify what their needs for that collective group are, so that they're not over-insuring themselves, is my understanding.
That's
You're
one of the
correct.
many reasons. Again.
Well, in
I've
terms
asked
of
the
what
doctor,
type
asked
of
the bill
policy
bank.
they're getting and what is it, are they in the right category over what they're getting? All right, because there are risks, so it's a free game, who they can shop around in, what they're gonna do, who's in, who's out, what the deductibles, what the copays. Normally, you know, when you take the small group market, you know, the only real issue is age banding, you know, and your employer can say, well, if my employees, I'm starting to age up, you know, I'm gonna be looking for a different policy than if I had mostly younger employees. So, you know, in terms of, it gives them something, you know, but it's general. These are big, you know, general numbers and not specific to your actual case,
Okay, so it will help them to figure out what policy suits.
which is the right policy to get. Exactly. That's what I mean by shop around.
Okay,
Feel better a little bit about it?
yeah.
Okay, good. Okay, so if we'll have an amendment for when we take this bill up tomorrow morning, and, so I guess you would want to go and have this amendment drawn up right now, so I can get it over to OLS.
It's easy to do, Mr. Chairman.
Okay. And simply now this is basically enabling legislation so the department can implement a new program that is catching fire across the nation. And but it will be dependent upon that money, pennies from heaven. Okay.
And
We'll be all right with
and we'll
that?
be praying.
Okay, we can't vote on because we don't have an amendment to vote on, but, so that's where we're at. So as a straw vote, are we all okay with it? Okay. All right. Okay. All right, one more.
7:30.
Uh, I thought I had all the amendments sent down here. Okay. Okay, shit. Uh, yeah. In your name. You ever got it? Unfortunately, yeah. How many people you didn't send it to? But it is quite a group. Good. Now I can figure out what it is. Yeah, yeah, I was just gonna. Okay. So, this is, hopefully a lot less pages, good. Okay. So obviously this is a much lighter form than the original bill. The concept was that if there is an underlying loan behind these settlements, that there is a responsibility for the judge to be informed of the issue, and then the judge can make a decision whether they share that information or not with the opposing party. Okay. So we have someone from, why don't you come on up, have a seat, turn your mic on, and just tell us where you want us to fix it, and we'll fix it. Yeah, there you go.
Chairman Hunt, my name is Anthony Scullambrini. I'm a lawyer in Nashua. There are a couple things I wanted to point out. The first thing is, and I know this doesn't really matter, but sometimes in legislative interpretation it does for the court. The title is New Hampshire Third-Party Litigation Funding Transparency Act. This is not really third-party litigation funding transparency because it only applies to one side. The vast majority of civil cases are defended by a third party, an insurance company, and there's no disclosure requirements here for insurance companies. So to the extent that this is about transparency funding, it should be two-sided, not one-sided.
So what title would you like?
I will tell you right now that I think that I'm speaking personally.
Yes.
These litigation funding people, it should be illegal, period, full stop. They should not have them at all.
Okay, I'll tell you a story.
Yeah.
You want to hear a story? Okay.
I'm happy to hear any story you
Because
have.
I said this is a short story. So I've been doing this for a very long time. And I was here when we had viaticals. Viatical.
Yeah.
Do you know what a viatical is?
It sounds like a medication, sir.
It does. You sell your life insurance policy. And the reason we were regulating it was goes all the way back to AIDS. And there were a lot of AIDS people who were given terminal notices, and they were selling their policies.
Sure.
Okay?
Yeah.
So to say that this is payday lending, lending,
Oh,
doing where all the, as far as I'm concerned, is that I've never ceases to amaze to me how
People monetize their lives.
what they're going to end up doing.
Sure.
And so and the argument back then was, for a patient that they could use the money to resolve issues that they were having before
Sure.
they died. And so why shouldn't they get the money?
Oh,
Okay.
I understand.
So before you, I'm just qualifying that for you when you go
Yeah.
forward. Be careful when you say that, because that and the reason why my wife made the comment is that we don't want the person who has been harmed, that once again they're being harmed again, in terms of, we want to make sure that if, because this is available, this has happened, we don't want them to feel that once again the state is, taking advantage, of the person. So,
Oh, I totally agree.
okay.
That's why I said personally.
Okay.
I don't think I'd have
Okay.
enough.
Well,
certainty
then
in my
keep the
opinion.
personal stuff out then.
Yeah. Okay.
Okay.
That's right.
All right, so I'm usually I'm a big have a problem with the section ones, which is the purpose and findings. So is in there, is there really this is how it's required disclosure funding company. So third party, that's what it is. It's a third party litigation.
I mean, we just
Yeah.
don't have enough of this in the state to make a real, it's not a big deal yet.
Well,
And maybe it will be. in
Yeah,
the future.
evidently it seemingly is. Well, because we have a problem with our nonprofits now, getting insurance, and so yeah, this issue is out there.
I that's a different issue, but I will
Okay.
say that from my perspective, this has really only cropped up recently with the YDC settlement claims.
Yes.
And that's primarily where all of this is coming from. But I think that, that's a fund that has a sunset, and when that's gone, I don't see why it would not revert back to normal. I think that there's a lot of people that are carpetbagging into New Hampshire to take
Right.
advantage of the settlement fund, and these people are one of them.
At the end of the day, the idea here is, we're not putting this to the Secretary of State's office, like the
Sure.
original, right? This is to the judge, and the judge can make a decision on the appropriateness of, the
That,
situation.
that's one thing I want to make sure.
Okay.
It does say all parties. So, except as otherwise stipulated by the order of the court, a claimant shall.
So where are
without
you? Tell me
awaiting-
where you are.
I'm sorry, this is page 3, line 22, 23, and 24. Without waiting, all parties in a pending action.
So what Roman numeral, or where are
This is
you?
1,
Or the line number?
22, 23.
Right, 22. Except as otherwise stipulated.
It seems like it does not apply to just the court.
Without waiting and discovery. Okay. All parties in a pending. The time, okay. Maintain thereafter in commercial. Sure, that hasn't. Okay.
So if it went to the court and was subject to in-camera review, it might be a little different.
Okay.
I think that would be, I mean, having done hundreds of pieces of in-camera review litigation, I cannot ever see a judge saying that this would be relevant for anything. I mean, it just doesn't have any bearing on the case, in the same way that plaintiffs'
Okay, well,
lawyers are.
I'll
yeah,
stop saying that.
Yeah,
Okay,
plaintiffs'
so-
lawyers are precluded from
Okay.
saying that this person is actually an insurance company. The litigation financing has no bearing on the facts of
Okay.
the law.
All right,
So here's another point that I want to make.
okay,
Same page, lines 10 through 12, paragraph 2.
okay.
And then the next one, paragraph 3. This imposes a lot of rules on the attorney-client relationship that I feel are really invasive. And so let me give you an example. There are often times when we have rare cases. For example, in New Hampshire, 1983 litigation is relatively rare. And in other states, because they have larger populations, the number of cases is much larger. And oftentimes what you want to do for your client is to give them essentially like a real estate comp and say, these things usually result in this kind of finding. And we've normalized it and based this judgment on a statistically valid sample of cases from other jurisdictions. Sometimes that's really hard to do. Like the rarer the case, the rarer the kind of litigation, the more difficult it is to find that information.
Right, so which specific part?
So
you're
that's what I'm saying. The commercial litigation financer should not make any decisions, have any influence, or direct any decisions. I could imagine a scenario where somebody who's good at this would have that database, and I would ask them, and the law precludes them from having any influence. It might be something that my client needs to have to make a decision, and there aren't enough lawyers in New Hampshire that do this kind of work to give them a relevant sample size of similar cases that were settled or resulted in verdicts at trial. So I think that this is one of those things that's just too invasive. And then the last sentence of paragraph 3, there is no reason to state that. That is the default. And so this is sort of, again, making a problem out of something that's not actually a problem. You have an ethical obligation of the rules of professional conduct to do this anyway. And there's nothing that the litigation funding source could do to change your ethical obligations. There's no amount of money that's worth my bar license because my bar license is how I make money in the future. So like, it just doesn't matter.
Okay, right, so we're talking about the right to make all decisions regarding a legal claim remains solely with the claimant and the claimant's attorney or law firm,
Correct.
which is
the litig-
stating the obvious.
It's stating the obvious, but it's also important to remember that this idea is mandated in the rules of professional conduct. And so if there is something that would come in conflict with the rules of professional conduct,
Right,
then I think it's incumbent to figure out how it would do so in as many cases as we could foresee. Here, I think like we don't need to state this. I think that this particular paragraph is especially invasive, and it's trying to tinker with something that fundamentally is a
but,
really
so,
private relationship.
but if rather than removing the whole paragraph, because I assume the whole paragraph is not a PUC, what do they, remember, professional conduct?
No,
right,
just the last
PCC.
sentence is the
Okay, you
problem
already taken
with the
that last
professional
sentence?
conduct.
Okay, all right, so starting in line 16, the last sentence, the right
Yeah.
to make all decisions?
Yeah,
got
you
that-
could, I
you
think
got
there's,
that, Kristen? Okay, we'll strike
And-
that.
and then the other one in the same paragraph, 13, have any influence is such a broad phrase. Again, I can think of situations in which,
So where are you now? I'm sorry.
same paragraph, line 13, have any influence. It's
Commercial.
the second of the parenthetical phrases after
have-
commercial
The
litigation.
commercial
finance.
litigation financier shall not make any decision or have any, or direct any decisions with respect to the court or legal claim, including decisions in appointing or county counsel, choice or use of expert witnesses, litigation strategy, and settlement or other resolutions.
So,
Let's see-
like, let me give you a very simple example, and we don't deal with this again because I don't take cases with litigation financing. But there are instances in which I want to have my client have a structured settlement. And oftentimes the structured settlement people will provide advice here that I could see a commercial litigation financer also providing. And I would not want to preclude my client from having the option of having settlement advice from somebody who does it professionally. In the same way that I would not want to preclude my ability to access these people's information in a way that might have any influence, because that's a really broad phrase, and how I advise my client. When you have a very small state like New Hampshire with a relatively commodious civil bar, there oftentimes are not enough publicly available settlements or verdicts to advise clients. And some of these groups that do this are national groups that could have large databases that could give my clients insights that I, as a lawyer, would not have access to. And by having the phrase any influence, and then the last one, so 15, the choice or use of expert witnesses, litigation strategies, or settlements, I could imagine somebody that's a good commercial finance, a litigation financier, having all of those connections and saying to me, Tony, I know a person that does this very rare form of expertise. Do you want me to connect you to that person? And under this law, that's illegal, even though I would not be able to find that resource myself. And so I would not want the statute and the legislature to enter into the attorney-client relationship on this level.
Gotcha.
It's too much control. And then the final thing, and this is the, I'm sorry.
Yeah, I'm just trying to, so, this shall not make any decision. Appointing, changing counsel, and appointing or changing counsel? Well, that's really weird, huh?
I mean, what if,
Say you,
what happens if you have somebody who doesn't know what they're doing and the commercial litigation financier says something to them in a meeting with the client, like, did you file this motion in limine? And the lawyer is like, ooh, I didn't. Is that violating this statute? And I think it probably is, based on the wording here. Because if there's any influence in changing counsel, pointing out to somebody, you missed this filing deadline.
right,
That might be something the commercial litigation financier doesn't want to have happen because it means the case gets dismissed and they lose their money. But at the same time, it might be functioning in the client's best interest. I think this phrase, this entire paragraph, is simply too invasive, and it is not precise enough to deal with the complexities of an attorney.
okay, I'm tending to agree with you, but let's see what else that
Okay.
you have.
And then the
Right.
last point I would make, and this is at paragraph lines 22 through lines 28. And this is, again, going back to my point about it not being symmetrical. If we really want to provide consumers with information that protects them in making decisions in legal cases, I want to know what the reserve amount is set by the insurance company that's defending the case. I also want to know what the hourly rate is for insurance counsel, whether they're a captured firm or somebody that contracts with the insurance counsel, because both of those things will give me information that I could use to advise my client about, well, you know what? The reserve that they have for litigation is $12,000. He's going to settle tomorrow because my guess is he's at his limit. So like if we're really going to pull this apart, then I want it to be symmetric because it's the only way to keep
No,
consumers informed.
we want them to have the best, they're giving up a big part of their settlement.
Sure.
That we want them to make sure they have the best counsel.
So I think that the disclosures should go both ways, not just
Okay.
with the plaintiffs, but
So
it should
what
also be the
is
def-
it that you want to see changed in this paragraph? I'm sorry.
I think it should be that any third party, whether they're indemnified or not,
Okay,
should have to make these disclosures, including reserve amounts and the rate for the hourly rate for counsel retained. They'll never agree to do that. Well, I would just want to point out the fact that this is completely one-sided. And if we ask them to do what this law is asking plaintiffs' lawyers to do,
Right.
they will never agree to it because it is supposed to be one-sided. But if you want to change the language
I like
to
the
make
idea.
it fair,
I like you want to make it fair. Yeah.
yeah,
Let's make
you
it
want
fair.
to have them
Let's make
both
it fair.
pointing
Let's
guns
just-
at each other.
I
Let's
don't
do
wanna-
it.
make them, maybe we'll scare them away so they won't do this. Okay.
Yeah, I'm
So
happy
we're-
to do that.
Okay, so what words do you want me to change here?
So if we had any commercial financing agreement, and then a separate sentence that would essentially say indemnified parties are under similar obligations, including the disclosure of reserve amounts.
Well,
Hourly
that's
rates
a
for
really big
lawyers.
legal phrase for me. You know, right? You're adding a new sentence into it,
Sure,
right?
sure. Yep,
Okay. You have a piece of paper and you want to write that sentence down?
I will write it down.
Okay. So, so you're the only one left here? Okay. Okay, do you understand what he's doing? He's saying, and do you have a, is it fair that we have both sides and be equal in this? You should probably sit up here with a mic, okay? Because this is how I like to do things. I want to have left and right. I like both sides. And I noticed that Lindsay and George had left, so I didn't see you
did.
over there. Right.
So for the record, I'm Cam Lapine. I work at Orin Reno with George and Lindsay. We represent the New Hampshire Association of Domestic Insurance Companies and the American Property Casualty Insurance Association.
Right. Okay.
That was a whole lot that was just said.
Okay, so do you have, are you overly offended by us moving that Roman numeral 3 section? I mean, we haven't agreed to it yet, but
Sure. So there is the right to make all decisions. There are cases. There's one case in particular that I have in my head right now involving Cisco, the big food supplier company. They were involved in litigation that involved third-party litigation financing from Burford Capital, which is one of the largest funds that
Right.
participate in TPLF. Cisco wanted to settle the case. They wanted to end the case.
right.
Burford would not allow them to do that because of their contractual obligation for the funding. It's an extreme example, but there are situations where third-party litigation financing companies are exerting influence on cases, and we don't want that to happen. So I think removing that sentence would be a problem.
Be a problem.
Would be a problem, yes.
Can I ask a question to Cameron?
Yeah.
In that case, what did the lawyer do? Because I think that's probably, I mean, I don't know the details of that, but just in that factual scenario. that's
Yeah.
Someone else can.
Someone who's actually an attorney.
Probably unethical. If the client says they want to settle, as a lawyer, you can't, I mean, ethically, you can't resist. You can withdraw from the case, but you can't resist in order to settle. I mean, they have an ethical right to control the goals of litigation.
So what happened?
So Nathan Fennessy, represent AIG. I'm an attorney at Pretty Flaherty. So what happened in that case was the third party financier got itself substituted into the litigation and took Cisco's place. And so they became the party in interest and took complete control of the litigation. So again, that's a situation that is something
Were
we're
they
trying to avoid.
indemnified or were they third party or were they financiers?
They were the financier and then took over their position in the litigation.
I want to ask you a specific question again. Were they indemnified? Because that's a difference, right? If they're indemnified, they're allowed to do that because they become the client. But then they're not litigation financiers at that point.
I don't know specifically,
Okay.
but I'm telling you that the third party financier took over the litigation from the
Which is
real party in
awkward.
interest.
Don't you think that's kind of awkward?
That seems a little awkward to me.
I think that like
So, what do you want to say? You have some? Yeah, pull the mic.
So just to answer your question about the specifics of the case, it was in the United States District Court, District of Minnesota, in regards pork antitrust
This goes to my joke about how you ask 5 lawyers and you get 6 opinions. Okay, so Jim, you have an opinion on this? Now, in this case, are you
I'm
representing?
representing State Farm,
You're-
and I'm
you're
always
representing
representing
insurance.
State Farm,
Okay.
nobody else.
Okay,
Um,
even though you work for a law firm.
Yeah, a lot of us do in here. With respect to, I mean, we're losing the forest for the trees here because in Article 3, line 13 in page 3, what we're really trying to get at is making sure that a third party doesn't control a litigation. And the lawyer is in charge of advising his clients, but in the context of a lawyer performing their ethical duties by have frank conversations, okay, you don't want a third party calling the shots. So I personally don't object to the removing the words have an influence, because if that third party is in the room, the lawyer can do his job. He can tell his clients, I think he's wrong. But what we're really trying to do here is prevent one of these litigation financiers from sitting in the room saying, you need to take that settlement. And that can be coercive against the law firm that is actually has taken out the litigation financing. So the other stuff.
So you're saying don't remove this paragraph?
No, I'm not saying don't remove the whole paragraph, but sure, take out the words have any influence, because frankly.
Well, how else do you change that sentence? Because otherwise you're going to make it from a shall to a may.
Shall
The commercial litigation financier shall not
make any
make
decision.
Any decision.
Or direct any decision, right? So you're basically saying you don't have the right to control to a third party funder. Yeah, they can still participate, and they can provide all the information that this attorney wants. I'm sorry, I've forgotten your name. Tony.
Anthony Scullenbrady. I mean, the other thing that you could do is simply have this paragraph say, the attorney retains the right of final refusal on any proposals made by commercial litigation financier. And then it doesn't matter. It matches and accords with the rules of professional conduct. Jim's concern is met, and the language is simplified.
Say that again?
Yeah, say that again.
Simply state that the attorney retains the right of final decision-making on all aspects of the case.
'Cause that's
Period.
new language, right? That's not here now.
No, that would
Right.
be it. And you
You're
wouldn't
just-
have to have this long, complicated
Yeah.
list.
Talking about what they can't do, but just say. with
Lawyer
the-
gets to make these decisions. This doesn't change it, period. Sure. The attorney retains the right of final decision-making on all aspects of the case in consultation with the client. And that just means that the rules of ethics apply as they normally apply. And the consumer, or the commercial litigation financier can't override anybody. But at the same time, if they want to collaborate and it's good for the client and the lawyer approves it, they can still do that. But by having this language that has all of these specific things that say you can't do that, you're making it really invasive instead of saying what we want it to say, which is the lawyer and the client still retain all of the decision-making in the case.
Yeah.
So
Place paragraph with that sentence.
So if you look at Article 3 here, okay?
Right.
What this is intended to do is to say to commercial litigation financiers, you cannot control this.
Right.
Okay, so if you're an attorney who wants to retain the final decision, I don't see what's objectionable about having a law that says you third-party funder cannot direct the decision. So I don't see what I have in mind as being inconsistent with.
Well, the question is that the third party is allowed to have an opinion,
Right,
express a point of view,
right.
but that at the that ultimately the final decision has to be made by the attorney.
And like, I don't think like in principle, Jim's idea of how the law would work and my idea of how the law would work, irrespective of language, will result in any different outcome. The concern that I have is that by making the law so narrow and prescribed, it makes it very invasive in a relationship that is complex already.
So I guess there is a point, and I'm talking to you, Brian, because you're the sponsor, that if we were trying to say what we really care about now is to make sure that this loan exists and is out there, okay? Do we really care about the details of that relationship between those people? I mean, do we really need this stuff in here? If we were just to keep it simple to say is the most important thing that we want to know is that yes, this lawsuit this deal exists, and let's just get rid of this, because I don't, this room's not big enough for any more lawyers. So maybe just get rid of this kind of stuff, which is, identifying, and I understand what you were trying to do, but it is more than what we really, I feel like we were trying to, resolve the issue with, which was just that it's,
We just don't want third parties influencing lawsuits.
you
We
know-
don't want them steering them towards litigation or
Right.
steering them towards other things or other avenues of things that are gonna cost more
I
money
understand
or-
you don't want that, but at the end of the day, what we're trying to do right at the get-go was that we at least want to make sure that the fact
Commercial
that,
portion.
that there is that loan out there,
Yeah.
and that they're, like, when say, well, who's this guy? Why is he in this room? Okay, well, he represents them. But in terms of why would we want to go into the statute, go into the detail about what he can or can't do, the judge can make that decision whether he thinks something's inappropriate going on. But all we care about was that, yes, that how do people feel about that? Does that make sense? So maybe we can get rid of some of this crap.
The one thing I wanted to point out about the example with the substituted litigation financier, antitrust law is very different than anything else in the law. It is a subspecialty that is very rare. Those practitioners only do that kind of work. It has to go to federal court. And I've talked to federal judges when I was doing CLEs, and they are aware of how unique and different that is than everything else. So to pull an example from antitrust law in Minnesota in the federal district court as a reason to justify this level of invasiveness in the attorney-client relationship in really basic, simple, straightforward civil cases in the state of New Hampshire is like basically saying that we need to change the way a saddle is made because there might be a unicorn out there. This is not the reality that most people deal with. Antitrust laws are very,
Okay.
very different.
All right. If we just got rid of paragraph 6, this whole prohibitions language. Can we just get this over with today?
Three,
Roman numeral, well, it's 294, on line 6, 294 F3, prohibitions related to commercial litigation funding.
On page 3.
Okay? Just get rid of that whole section. Can that just make your day and we can be done with this? That,
Lines 5 through 20.
so it'll be line 5 through 20 is correct. Because we are not qualified to be doing this conversation. This is judiciary. And so I just, and I'm a big believer of KISS.
Can I make
with that.
one
Yeah.
pitch for the reason why you would want to keep that?
Yes,
So
okay?
I am an attorney. I do practice. I don't just hang out with you guys up here, as fun as it is. So the reason why you would want to keep that language is it's really informing the client. It's not for the attorney. The client is ultimately the one that's the decider, that makes the decision whether or not to settle a case. And I think in a lot of these situations, you're, particularly I'm thinking a scenario where they are going to feel pressure both from the attorney and from the third party financier to go in whatever direction. And by putting this into law, you're giving them some information about what control they have and the manner of influence that's inappropriate in that relationship.
Well, they should make the decision before they take the loan in the first place.
Then-
You should, if you're taking this loan, you're doing business with these people, you gotta know, what their motives are. And if you want, to me, you're selling your soul to this company.
yes.
And so that, the fact that you've made that decision, I to then say, okay, now we're gonna say, what you can or can't do to the devil.
I guess I would just say the circumstances under which you enter into like a commercial litigation financing tend to be sort of these like bet the company type pieces of litigation where you may not have much of a choice. This is the only way that you can sort of proceed with something to keep your operation going.
I sure hope their attorney who they had with them before they signed up told them that.
the other thing I want to point out is having this in the law does not mean that the consumers will understand it any more than banning murder in the law means that murders will go away. So like, I hear the logic, it's not how the real world works. The people who are in these situations are trying to figure out how to pay their bills, and they're not going to go to RSA 294 F3 and be like, now that I've read the statute and I'm in this huge jam, I think I want to tweak these things. This stuff is simply required by the rules of ethics. All of the concerns that have been raised here are things that competent lawyers have to deal with every day.
And not just the rules of ethics, I would add, but the rules of automatic discovery and disclosure, Superior Court Rule 22. Our tort system has existed for hundreds of years. There's almost nothing new under the sun that our courts can't interpret and contemplate.
I mean, I understand, you know, we all know who the devil is here, right? The company that's seemingly taking advantage of the plaintiff. And but I guess I had made the decision before last week or where I said I just want to narrow this down to let everybody know that this exists. And but in terms of trying to educate people or how to set rules and this, this is way over my pay grade in terms of legalese. So, and it's going to another committee, right? So I don't know where it might be going to. I don't know. No. I keep telling everybody, fiscal note means not where it goes or who anything is. The fiscal note means that when the bill was drawn up, that the drafter, based on the RSAs, sent it to some department who might care about it. That's where a fiscal note comes from. So it has nothing to do with where the bill goes to a second committee. But did this bill never had any money in it, right?
It did originally.
Oh, well, the Secretary of State was into it. Okay. All right. But that's already long gone, right? Yeah, with this paragraph. Okay. Yeah. What I'm playing with the concept, if we just remove 294F:3, prohibitions related to commercial litigation funding. No, we made the whole thing disappear. We made all that. So F4 stays there, right? Because you don't have any problem with F4?
Well, the note you have here is that it's not symmetrical.
We'd like to make it symmetrical. By inserting after on line 25 on page 3, after the phrase executed or amended, insurance companies shall be required to make similar disclosures, including reserve amount, litigation budget, and the hourly rate of retained counsel. And that way, everybody's playing fair. Both sides have to make disclosures.
So you want the insurance company? What did
Yep.
you say?
So the insurance company indemnifies the defendant. They step in and control the litigation in a much more intrusive way, to be candid, than the commercial litigation financier. They can do everything because of an indemnity agreement. And since we're treating these outside third parties for protection of consumers in this law, the question is, should it only be one-sided? And I don't think it should be. And if we want to make it symmetrical, then the insurance
Wait a
company.
minute, I'm totally
Yeah.
confused here. I'll step back. So now we're saying that the defendant, in our case, is the state of New Hampshire.
No,
No.
that is not correct.
Okay, the defendant is I thought was the plaintiff, the person who's suing the state because they've been harmed.
No, the plaintiff is the party that does the suing.
That's the plaintiff. right?
Okay.
Okay, so in this case, this is,
Let's have Tony come up with an example of, say, a slip and fall.
Yeah, like a slip and fall. You go to Market Basket, you're picking out bananas.
Right.
You slip and fall. You sue Market Basket because they didn't put that, sticky
Right.
felt tape down.
right,
You are the plaintiff. Market
Right.
Basket is
is
the
the
defendant.
defendant, okay?
So it is very rare for the state to be the defendant in a case like this.
Okay, so dealing with the defendant,
Yeah.
okay, Market Basket.
So Market Basket is a little different because they're self-insured, but if it was like Hannaford, they have outside insurance. And so what happens exactly? the outside insurance steps into the shoes of the defendant and makes all the controlling decisions in defending the case because of an indemnity agreement that's part of the insurance. So what I'm saying
No,
is,
no, that has nothing to do with this.
no, but what I'm saying is, if this is truly about third-party funding in litigation, then the defendant's third-party funding should also be required to make similar disclosures.
They already do so under Court Rule 22.
They do not. They do not have to disclose their
Holy
reserve amount.
moly.
They do not have to disclose their litigation budget. They do not have to disclose the hourly rate for defense counsel.
that sentence down somewhere?
I did.
All right.
Why don't you just
We'll just put, all right, we'll put the. Right now, yeah, how do you guys, you obviously feel different about this, right?
No, we feel the same and we just,
No, I'm saying you
wondering-
feel, right.
yeah, we feel different from Tony.
It just feels like the issue here was not about insurance companies. The issue was about someone who was financing the settlement. Okay?
But that's not what the title of the bill is.
Well,
The title of the
okay,
bill
I
is
can certainly-
litigation funding transparency, correct?
Litigation funding.
And the
Right.
insurance companies are funding the defense.
How about third party settlement funding? No,
Same
I
thing.
can't-
And the
if you don't
insurance
like, I
companies
get,
are
you know what?
inextricably
I'm
involved.
fine, but you know, and what, I'll tell you what, I feel like we're, it's good to get rid of that prohibition thing. This issue here, take it up with the Senate.
Sure.
Take it up with the Senate. But I don't think we need to get into that. Because that's not what this bill is about. This bill is not about, that the fact that Market Basket said, okay, insurance company, this is your case now, you're walking away from it. No, that's not, I don't see that. It does make sense. It does make sense to participate. Think about it, and that is, okay, if I'm in a car accident, okay, and whether I'm at fault, in terms of, yes, it's a big lawsuit around it, okay? So I have maximum coverages, okay? And I have an umbrella, all right? So what I'm saying is that, yes, at that point, my umbrella is running the case because they're defending me, all right? They're the ones who don't want to make a big settlement. So what disclosure do I have to do I need to, I think this was like the bill we had last year, where was you supposed to disclose, exactly. So at this point, I do say, I understand where you're now coming from, and no, I don't agree. I think I voted the wrong way on that issue for you. Okay, so at this point, I think that's not necessary. I really don't. That's not what this. I understand that you think it should be a fair and equal thing.
I'm
but-
always in favor of fair and equal. If we're not, that's a
right,
different
right,
story.
right. Not just like,
Can we change the title?
no, I don't, we don't need to change the title. Okay, we're gonna just, at this point, I'm only missing, is there anything else we need to, anything else other than that?
I think we're
You beat this horse?
beat this horse.
Okay. Okay, so now we want to talk to the subcommittee because we want to see whether. Okay, lawyers, go back to your
No lawyer.
corner. Go back to your corner. No, you're the lawyer allowed to stay. The only lawyer allowed to stay. But and that's right. And you don't have standing when it comes. Okay.
Is it more about investors, outside investors pitching in
So the
to support a
investors,
dependent?
yeah, they're pitching in, but what the whole issue with that was going on is how much of a role, because you are investing in, how much is a role you have in how the case is being run and operated. And, and to me, they're the devil. Okay, this, the idea that you're going to go out and have somebody, pay, give you money up front,
Yeah.
based on the case, it's a little.
I think the
it's a
discussion
little-
got sidelined, but I think the main.
that's where predatory. It's predatory. It's icky.
Cases are a very good example. There's a lot of money involved.
That's a lot, right? Well, and the fact that they're slam dunk cases, but didn't they lose one of the cases? Just the state won, I guess. But okay. So I just want, is everybody comfortable? Okay, so so that's where it begin. Right now, where I think I am, and where I think we are, is just removing 294-F3, prohibitions related to commercial litigation funding. So we're just moving that section of the bill. Removing. F4, I don't think we need to mess around with F4, it's fine. It's just F3.
So basically, you're allowing a third party financial or outside investor to pitch in the money to run the case.
At this point, we're not getting into what's the nature of their relationship or what they're doing in the case or how they muddle things around.
Right.
What we're just trying to do is get everybody aware that it exists.
We're not saying you can't do it. We just want to know that you're doing it.
And as the lawyer was pointing out, that most of these things actually, there is case law that you can't do it. And they're rules. Okay, so they're legal rules. So, and we know the problem with rules. Okay, so at this point, we can, I mean, technically, we don't have a correct amendment. So normally I wouldn't have us vote, but so I would say is a straw vote. Are we the straw vote? Are we okay with this amendment 0631 less section 294F3? Okay. Yes. It's a nuance that he was trying to get into in terms of the lawyer, about if the insurance company, okay? Because remember, what's driving this legislation is insurance companies are pointing out that they play an important role in settlements, and so yes, we respect his opinion that he's, because that's who's usually on the other side of cases that they're dealing with. But that's not what this legislation, he has a great argument to go to the Senate and say, this is not fair, it's unequal. But at the same time, I would say is all we did is had put something in that is disclosing that everybody now knows that it exists. Okay? You all right with that? Okay, so the straw vote is accept this amendment 631 less section F3. And that just so for minutia, that when you see this bill tomorrow, all the things will get after. So in other words, the F4 will now become F3. They just move things up. We're executing that tomorrow. Okay.
Okay.
I will take care of getting it done. Okay, all those in favor? All right? Great.
Yeah.
Okay.
6 then.
Right.
Because Gibbs isn't here. Gibbs is not on this committee, on the 7.
Okay. Yes, 7. Yes. Yeah, yes, Cam. Okay.
If you're going to remove that 294F3, there are some definitions that are no longer needed. Like all of the definitions beginning on page 2, line 23, that is all about the foreign entity of concern, which if you're taking out that's no longer needed.
Because there's a reference to foreign entity of concern.
So 294F3, which you just
294,
agreed to remove.
Right.
Right.
Right. Okay. No, but which definition don't you like?
Oh, sure. Oh, well, it's not that I don't like it. It's that you
sorry.
removed it.
Which one it doesn't need to be?
Page 2, line 23
Page
through
2.
through page 3, line 4 is no longer necessary.
Wait a minute now. Okay, I'm on page
Sure.
1.
So-
And my page 2 definition. Okay, so which definition are you starting with?
So page 2, line 23,
23.
Roman 5, foreign country or person of concern. You've removed the section of the bill that
That
dealt
is
with
true. So
foreign
that
countries
should
of
go out.
concern.
Yep. And what else? So what else did you say?
So it would be page 2, line 23
Yep.
through page 3, line 4 is no longer
So
necessary.
for all the foreign entity language
Yep.
is only in that paragraph?
Yeah, it only appeared on page 3, line 8, which you've removed.
But in reality, that's probably not a bad thing because it's the full disclosure. It's about disclosing.
Define which way? What are you saying? We're apt to leave it, and then we would just take out. So if I go back to Roman numeral, a commercial litigation financier shall not enter any commercial litigation financing agreement directly or indirectly with a foreign entity of concern or a foreign country or person. Oh, okay. So that means we will leave F3 in there, but only Roman numeral 1. Yes.
We'll leave the definition in.
All right, so what do we do?
Okay, so now, by not having to mess around with definitions, now the only thing what we're gonna remove is, no. We're just, now we've just shortened how much we're moving. So now we're going, where he says 294 F3, where we're prohibition related to commercial litigation funding, we're saying, we're leaving in Roman numeral 1. But we're deleting 2, 3, and 4.
So lines 10 through 20 on page 3 will be deleted.
Okay? You don't care? No, you don't shake your head and say sure. Oh, good. Yes.
Of course. Nice try.
You know, in retail, we say you gotta ask 3 times. Okay, so, all right, so delete just
Lines 10 through 20 on page 3.
Roman numeral 2,
2, 3, and 4.
3, and 4.
And then you don't have to renumber.
No, now everything else gets to stay the same. Okay. Leave the definitions because we don't want foreigners.
Those Chinese companies coming in,
Chinese
taking over our.
So that's a good thing. We ban, large we're large percentage of the world's population. So you got half a loaf there. I know you will pull out on the Senate side.
The other bill was never going to go to a second committee, but all the funding got taken out. So maybe that's what the second committee. Insurance.
Yeah. Well, what happened is if it was originally designed supposed to go to finance, okay, the other bill, the insurance bill, the paint bill, yes, the funding mechanism. That means it was probably going to go to finance, and Ken Weiler will move not to waive.
That means it has to go on the consent calendar. It can't go on the consent calendar.
At this point, we would leave it on the regular calendar. Just
We have to talk to them.
no,
No,
No.
you just voted.
we just voted.
No, I mean, when the time comes, when you leave something on the regular calendar, usually somebody gets something.
could
they
be a
don't
voice
want.
vote.
I hope you give them a dirty look. Yeah, no, it's a voice vote. Yeah, if nobody signs up, it's a voice vote.
Okay.
Right? No, we.
When I speak from the well, I don't hear good enough to figure out what the heck is going on.
Okay. All right. So does everybody understand the agreement that we're going to just remove paragraph 2, 3, and 4?
I had my hopes up.
That's tomorrow.
Okay.
All right.
All right. We're good. All right.